A very good morning to one and all assembled here. Let me at the outset thank God for all that He's given and blessed us with. I thank for giving me this opportunity to introduce our chief guest, Dr. Avadhesh Pandey. Doctor is a senior consultant by profession in radiology and nuclear medicine expert. Curing impossible patients is his challenge. His qualifications being MBBS, DRM, Diploma in Radiation Medicine, MD, Nuclear Medicine, DNB, Diplomat of National Board, MNAMS, Member of National Academy of Medical Sciences, PhD, Yoga and Naturopathy. Also a PhD in currently pursuing in Endocrinology, Pineal Gland. Doctor's achievements being 13 publications in national and international journal, twice awarded for Young Scientist Award, more than 400 oral presentations in national and international fora, senior consultant and head in IIIMS. The positions held presently are Chief of IIIMS, Subharti Medical College, co-founder of HIIMS, DR.AWADHESH Chandigarh, founder and CEO of the Third Eye, DAP, Institute of Integrated Medical Sciences, Dehradun. CEO and Chief Consultant at IINMAS Group of Diagnostic Centers, New Delhi, Chandigarh, Dehradun, Jalandhar, Amritsar, Meerut, etc. Ladies and gentlemen, it's my honor and privilege to present before you our chief guest, Dr. Avadhesh Pandey. The floor is yours, sir. Thank you.
Thank you very much, and that was a very detailed introduction. I don't know whether I deserve it. I'm so thankful to Rotary Club, Chennai, and Rotary International to have invited me here. I'm special thanks to Mr. Jayanathan, Dr. Lakshmipati, and everybody else who actually made it possible. We will try to, in some time, we'll try to fix many things that are a question mark as far as you are concerned. You just heard nuclear medicine. This will be new, it will be clear, new, clear, integrated medicine, wherein you will understand clearly how, what, how much, and how to do it. Moreover, what is life? And how are we functioning? Are we really functioning how life is? So we need to answer all these queries through integrated medicine. We'll make it very simple. We'll be disease-based and we will be interactive more rather than speaking. So let food be thy medicine. We are in our hospital in Dehradun. If you come to the Third Eye, you will see that it is surrounded by the Himalaya Parvat all over. And Sahasradhara River, which is the core healing property of Ma Ganga, is from Sahasradhara. Sahasradhara is flowing through our property. So this is where the Third Eye is located. Unfortunately, we don't have a picture here. I would have showed you. Hey, picture hai? In fact, it reminds me to carry a picture. So that is a very beautiful location where we are. And patients, when they arrive there, we don't call them patients because they might have arrived on a wheelchair or a stretcher, and we ensure that in 5 to 6 days' time, they are on their foot, and by the end of 10th day, they are jogging. So we ensure that. And most of the times, we are successful. Many times, because of the disease process, many times it might not be possible, but most of the times, many times surprising to us also, it's successful. How life is, how simple it is to cure, how complicated we have made things. We have made things very complicated because of our complicated understanding. Simple things like the curcumin is very good for curing infection. Right or wrong? Wrong. 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 We have to unlearn many things to learn new things. Curcumin will only be effective if it is with the whole haldi. If you extract curcumin, it will not be effective. This is where the understanding of the human body is important. Most of the doctors who are specialists, we call it in Hindi, we call it Visheshagya. It is time you should be a Sarvagya rather than a Visheshagya only. Unless you are a Sarvagya, understanding of the disease process and curing a disease remains a dream, a distant dream. So we have to understand the Daihik, the Daivik and the Adhyatmik aspect of everything before we can treat any disease for that matter. I, being a radiology and nuclear medicine person, it was very easy for me to transform like this because our role in modern medicine starts when a girl is pregnant. Our role starts. The test is a blood test or a urine test to confirm pregnancy, but the definitive test is an ultrasound. It's an imaging. We need to understand. So, life starts, our role starts. And you just now saw Lakshmipati showing you, we certify brain dead. So when life ends, we are there. So throughout the journey of how life started till the life ended, we are there. So we have a very brief and good understanding of what any disease process is. Because if you go to a cardiologist saying that, you have got protein in urine, he will say, wait. I'm a cardiologist, you have to go to a nephrologist. If you go to a nephrologist and say, while I'm taking your tablet, I'm getting a chest pain, he'll say, wait. You go to the cardiologist and you first ask him, what is the problem? So we need to have somebody who knows the whole body. And as effectively as the specialists that they have. So here the role of a radiologist comes because since we are dealing with cardiology, we have to know cardiology inside out. If we don't know cardiology inside out, the cardiologist firstly will take you for granted. Secondly, he will not refer a case to you. If you go to a urologist, you have to know urology inside out. What surgery has been done, what has been done, what is the expectation, is the image showing that expectation and things like that. So in a nutshell, to become a radiologist, you have to know all branches of medicine very well if you want to become a successful radiologist, otherwise you are not. So after that, what we saw is patients are not getting any better. After so much treatment, so much advancement that is being claimed, patients are not getting better. Medicine must have advanced. The diseases have also advanced. And patients are not getting cured. Simple thing like diabetes. Diabetes, we don't even consider it a disease. It's a very small disease. We take maximum 72 hours to cure any diabetes, any known diabetes. I don't know any diabetes that cannot be reversed in 72 hours. There is no diabetes that is, yes, diabetes type 1, type 2, type 3. I don't know how many people have heard about type 3 diabetes. Type 3 diabetes is Parkinsonism. You must have heard the hands start trembling and they start losing memory. That is type 3 diabetes. So type 1 is an autoimmune disease. To tell you very frankly, rheumatoid arthritis, multiple sclerosis, bronchial asthma, we take 45 days to reverse the disease completely. And we feel very good if any patient from autoimmune disease contacts us. We know, heart of hearts, this patient will be able to cure. So we are very happy to get these patients. The challenges that we are facing at this point in time is cancer, and we are trying to reverse cancer. One day I was in a talk with many distinguished people who are practicing oncology, radiotherapist, chemotherapist, that is medical oncology, and surgical oncology. All these three were there. They were not liking the way we were projecting oncology there. So they told me, so I told them with folded hands, see, all of us are trying to get the patient out of cancer. You give me names and addresses of one person who after your surgery, radiotherapy, chemotherapy has been cured of cancer. You give me the name and address and telephone number of one person anywhere in the world. I'll be ready to go there, meet him and find out whether he has been cured. I can give you 24 which I have cured. There is no cancer. Cancer is not left. So, but cancers, we yet don't claim because we are in the process of reversing many diseases. You need to understand the difference between treatment and reversal. Treatment means commerce. If I am treating something, that is commerce. There has to be commerce involved. Reversal is I am empowering you to become your own doctor so that you cure your disease process. I am not involved. मैं तो एक रास्ता दिखाने वाला बंदा हूँ. I'll just show you the way. You have come here, asked me how to do it or where to go. I've showed you the way. You go there, turn left, right. Yes, please follow that way. Because unless you do that, you have very few people who will show you that way. So this is what we tell our patients. So starting with the next slide, please. Okay. Okay, we pursue science. The definition of medicine is if people must be having handphones and they must be having access to Google. If you type, what is the definition of medicine? How do you define medicine? So the definition of medicine is the science that heals or cures or prevents a disease is called medicine. It is not paracetamol, it is not antibiotic pill, it is not this pill or that process or that procedure. It is the science that prevents or cures a disease. That is what is medicine, and we are practicing medicine. So medico-legally we are correct. The second is we are not using chemicals. We are not using any known medication pharmacy, but we are using pharmacy, only with a spelling change. The pharmacy is Pharmacy. I am using pharmacy as Pharmacy. The farm produce is being used as medicine. So that is what is called, let food be thy medicine. So rather than medicine being your medicine, let food be thy medicine. So why? Because if your food is good, medicine is not required. If your food is bad, medicine does not work. So you need to understand what is the bottom line. The bottom line is not medicine, it is food. If you realize this statement. Nonetheless, the highest known scientific equation to mankind is this. Until string theory comes, maybe next year it might come up for a Nobel Prize. People who are interested in physics will know what I'm talking about. Why physics? Because we use physics as medicine. We use posture as medicine, we use heat as medicine, we use light as medicine, we use sound as medicine, we use vibration as medicine, we use many things as medicine. Which is why physics is important. So starting with, this is an equation which people must have seen, must have known. Everybody would be knowing. E is equal to mc square. Now how do you explain this to somebody sitting in Meenakshi temple, Madurai, who is a pujari? How will you explain? What is E is equal to mc square? He will not understand. Or even if he does, he will say, how does it matter? I am with the Lord. So first, the definition of Bhagavan. Who is Bhagavan? India, Bharat. I prefer calling India Bharat because this is a distorted name. The real name is Bharat. I prefer calling Bharat. Bharat में भगवान. और भगवान कौन है? भ से भूमि, ग से गगन, व से वायु, अ से अग्नि, न से नीर. प्रकृति पूजक है हम. We worship nature. This is what is भगवान. भ से भूमि, ग से गगन, व से वायु, अ से अग्नि, न से नीर. This is what is भगवान for you. Now, since हम प्रकृति पूजक हैं, we worship nature. So, nature के साथ we know how to stay with nature. If you look at the rest of the cultures, Bharat is a Yog Bhumi, rest are Bhog Bhumi. So, rest of the cultures, if you see, apart from Bharatiya culture, Bharat knows how to stay with nature. All other cultures have nature stays outside their walled cities. Outside their walled cities is nature. This is their kingdom. It is not with Bharat. Bharat stays in nature. So that is the basic difference as far as history is concerned. We need to understand this. Now coming to this equation, how do we explain E is equal to mc square? Which means, why was this important? Energy and mass came on the same platform. It's a very big thing. You have made energy come on the same platform as mass. So suppose if this is there, this is maybe 50 grams. If I give it a c square force, c square is cosmological constant. If I give it a c square force, this will be converted into energy. And if I cool down that energy, that will be converted into mass. So what is the problem in understanding or making the priest understand? Sukshma roop dhari siyai dikhawa, vikat roop dhari lank jarawa, bhima roop dhari asura sanghare. What is the problem in making them understand that? This is science. We are just trying to interpret it the right way. And this is exactly what we are trying to say. This equation might have looked very difficult to you up till now. But don't you think we made it very simple? Which is how we are making diseases very simple to understand, very simple to assimilate, and to take it out of your body. It's not very difficult. The third is, we use fasting as one of the tools. And I want to clarify, fasting means what? First is, Sanskrit does not have any alternative in English. There is no word. I'll tell you how. Every word has got a vilom. Sukh, dukh. Happy, sad. So these are anulom, vilom words. English is a poor language. It's a poor language. It does not have it does not have a rich culture. It does not have a rich background. It is a copy paste of Sanskrit. I'll show you how. You have Google. This part of the brain let's stick to medical science. This part of the brain is called cerebrum. This part of the brain is called cerebrum. Cerebrum. If you type what is the etymology of that word, they will take you to Greek, because anything you say English, they will take you to Greek. The Greek word, I don't remember that word, that does not match with cerebrum. Anyway, what do we call it in Sanskrit? We call it Shiro Brahma. Shiro Brahma, cerebrum. Does it ring a bell that it's copied and pasted from India? So English, we know how dictionary came. It came from Diksha. Diksha produced dictionary. So, all these things that they boast, that they know, and they claim that Bharat does not know, we would want sometime to, in one of these news channels, to have a debate with them. We would make them feel what is Bharat. And we would love to do that, especially to the British. Especially because these are the people who have actually made India the way it is. 75 years since independence, what should have gone? You heard the Prime Minister talking from the Prachir of Red Fort. He said that gulami ki har wo cheez jo dimag mein bandi hui hai, usko todna hai. What should have gone 75 years back was breakfast, lunch and dinner. It should have gone with them, because ek baar yogi, do baar bhogi, teen baar rogi. If you are eating 3 times, you will be a rogi today or tomorrow. If you are healthy today, be thankful that somebody is trying to tell you, stop. And this is the concept of Bharat. Do June Bhojan. Do June Bhojan is the concept of Bharat. That is why you have to be a Bharatiya first to become healthy. Unless you are a Bharatiya, you will not be healthy. Why I am wearing this outfit? Many people must be thinking, because Britishers को नीचा दिखाने के लिए उनके कपड़े में आना पड़ता है. अगर मैं गेरुआ में आऊँगा, तो वो बात समझेंगे नहीं. They will take me casually. Although internally, अंदर से we are this, but बाहर से हमें show करना पड़ता है who we are, and we can speak better English than you. We understand English better than you. Then only they will understand who or where we are coming from. So anyway, so let's start with. So pharmacy, I've already told you, E is equal to MC square was important for us to understand. Complex things can be made very simple. You need interpreters, and doctor is supposed to be a teacher. If you look at the dictionary meaning of a doctor, doctor is a teacher. So we are trying to teach. We are trying to tell you what it is. These are very simple things. Don't complicate your mind by big words. That is how English scares you. They scare you into believing many things which are not there. Don't get scared. Health is very same. Let me assure you once again, health is very simple. Don't complicate it, you will be fine. Next slide, please. Sorry. Yeah, so you recognize this? You know what this is? So if you soak it, it appears like this. Can you see these? They look like your arteries of the heart. This is nature's signature that if your heart arteries are blocked, what you should eat. What did you expect? Nature will call you up and tell you? They have already given you a brain to understand what things are. This is nature's signature that we miss. We miss this. Let food be thy medicine. Next slide, please. Yeah, look at this. This appears like a brain. So is it rocket science to find out that if you've got dementia, what you should eat? Is it rocket science? Nature's signature is already there. You just need to identify it. So, let food be thy medicine. Most of the diseases that you feel start in the digestive tract. We will explain 2-3 things here. One, the immune system. It's very important to know what the immune system is. And what is the immune system? Can anybody help me? Tell me from wherever you are sitting what the immune system is, or what is your understanding of the immune system, because unless you understand the immune system, you will not be empowered to cure yourself out of your disease process. So we have an august audience, which means where our understanding level is very high. Very nice, sir. Thank you very much. Immune system does not only guard from outside invaders, it guards from inside invaders also. So, like in Bharat is fighting a 2.5 battle. 2.5 means what? One is Pakistan, one is China, and 0.5 is the enemy sitting inside. You get my point? So that is a 2.5 battle that we are fighting. So the body is also fighting a 2.5 battle, or maybe 10.5, or maybe 100.5, because invaders are many. So to understand a disease process, there are 10,000 diseases known to mankind. Only 10,000, please. A doctor might sound very big, that I'm a big man, I travel in a BMW, and I have a private plane, whatever it is. There are only 10,000 diseases. 9,985 to be specific. Only this much. So many diseases, so many healing modalities. Somebody will say, I want Ayurveda. Somebody will say Naturopathy. Somebody will say, no, homeopathy is best, and this is best. 9,985 diseases. Let's take it in a collective way. So many diseases, but the ways of getting sick are only two. There are only two ways of getting sick. If you can prevent that, you can prevent any disease. So what are the ways of getting sick? Pathogen causes diseases. It's an agent. Pathogen, it's called. What is the full form? Pathology generator. In short, it's called pathogen. That is what causes a disease. The pathogen can come from outside, like corona, or an inside cell can become pathogenic, like cancer. So we need to understand that it's the pathogen that causes a disease. So if a disease is coming from outside, like in COVID, whoever believed in us, that time I was just a radiologist, I was not even practicing integrated medicine, because that gave me a boost, and a boost from the people that you should come forward to save humanity. Because that was the time we did it free of cost. Nothing, we didn't charge anything. But whichever patients followed us, they are still jogging. They are still jogging. We did not charge them anything. We did not use any known medication that you are using to prevent or this or COVID or mask or nothing. No social distancing, we hugged them. And I did not get COVID, by the way. So, not that we are trying to, but a simple understanding of the disease process is very important to cure it. If you don't understand how many people are hypertensives here? Please raise your hand. Hypertension. So you should ask your doctor, what is hypertension? He will say you've got essential hypertension. Have you ever asked him what is the meaning of essential? Was it essential for you to get hypertension? What do you mean by essential hypertension? Essential is idiopathic. I do not know why you have got blood pressure. If I don't know why you have got blood pressure, how will I treat it? Isn't it simple? Diabetes. They will say diabetes is a blood sugar disease. I will tell you, diabetes is not a blood sugar disease. How many people agree with me? Diabetes is not a blood sugar disease. You can quote me anywhere. I am technically also right. Blood sugar is an effect of diabetes, not the cause of diabetes. And the whole world is blood sugar, upar niche. This drug will make my sugar go high, this will go low. This is good food for blood sugar. It is not a blood sugar disease. Where are you? Where are you? Diabetes is caused by hyperinsulinemia. And this insulinemia starts with a fatty liver. Interestingly, it starts with a fatty liver. How will you diagnose fatty liver? If you have access to somebody like me or Lakshmipati, you go to them and you say, एक बार probe लेके देख लो यार, fatty liver है कि नहीं है? You might say that. We can do that. But if you are at home and you want to see whether you have got fatty liver or not, how will you know? एक selfie ले लो ना, मालूम हो जाएगा. If you take that selfie without filter, you will start hating yourself. Oh, मैं इतना बूढ़ा दिखता हूँ क्या? नहीं यार, कुछ filter लगाएंगे. हाँ, अब ये ठीक है. And then you'll put it like that. सीधी बात ये है, your face reflects how your liver is. If you want your face to look better, make your liver better. And if you come out of fatty liver, your face will be like a small child. So you know how L'Oreal ka cream lagane se you don't look younger. Let food be thy medicine will make you younger. So unless we understand that, we will not be able to, Mrik Trishna, that a mirage that someday I'll look like Aishwarya Rai, that mirage will always be a mirage, it will never be a reality. If you really want to make it a reality, it's not very difficult. It's not very difficult. You just have to zip your lips, zip it. Because if you don't zip this, it will be difficult for you to sustain yourself in this complicated world, which is actually very simple, but appears to be complicated. So that's how it is. So, coming to simple diseases like anything, two things you need to take care. A disease might come from outside or an inside cell becomes pathogenic. We'll talk about corona because, these diseases are actually causing a lot of problems and a lot of people are not understanding what that disease process is and how to come out of it without any medication. So we'll just recapitulate for the benefit of all so that from next time onwards, whether it is this pandemic, that pandemic, any bacteria, any virus, anything that is causing fever, that is coming from outside, how you should deal is very simple. So if a pathogen is coming from outside, how will the body react? You think the body is stupid? Because modern medicine feels this body is stupid. This body cannot do anything. Whatever reaction the body is happening, we need to suppress it. Is the understanding of modern medicine. That is why the understanding of the immune system is very important. What makes up the immune system? So first we'll talk a little bit about immune system. It will be very interesting for you to know. Immune system is a system of the body which controls all other systems of your body. So whatever system of your body you know, it is controlled by the immune system ultimately. And you feel Meenakshi Temple, Madurai has got God inside. You feel the church that you just visited has got God inside. You feel the masjid has got a God inside, the God is sitting inside you. Where are you looking for him? You're going to mandir, masjid, gurdwara, church, looking for him. He's sitting inside you. And the name of the God is the immune system. So that is the importance of the immune system. The immune system is your God sitting inside you. This is the same voice that always told you not to do this, this is not good for you, this is not. This is the immune system for you. It talks to you. You just have to know how to open your ears to actually listen to your immune system. So the immune system starts physically where the immune system is. 80% of your immune system is inside your gut. 10% is on your outer coverings and 10% is on your inner coverings. That's it. That is the immune system for you. The organ where you can touch the immune system is the tonsil, is the adenoid. These are the organs of the immune system. If you're taking it out, many times, we feel, oh, tonsil, the doctor will cut it out and I'll be fine. Beware, you are taking out your immune system. You need to be aware about that. So we need to understand what the immune system is. This is the immune system for you. It will protect you from anything. You have to know. The last pandemic, the people, when they died of corona, nobody died of the virus. Many people must have lost with due respect and regards to their kith and kin. Nobody died of the virus. Their immune system killed them. So it is an important thing to know what the immune system is. Why did the immune system kill them? Because our basic understanding of the immune system all over the world is, I should say, without sounding immodest, our understanding of the immune system is zero. Simple thing like virus, if it is killing people, then we are just talking and talking and talking and talking. We are not walking the talk. We are just talking. We need to walk the talk. So the walking the talk was, for us, what we did was, immune system is run by T and B cells. Many people know. Immune system was the most searched for word during the pandemic times. It was the most searched for word. Immune system works on T and B cells. T cells are this and B cells are this. T and B cells work only with drivers. The driver of that immune system is not there in you. Learn it from animals. Daya, Maya, Mamta, Karuna. It's not there with you. आप दयावान नहीं है. You don't feel sorry for people. You don't have these things in life. If you don't have these things in life, these are the drivers of the immune system. So don't be surprised if your immune system is going berserk. Install this in your life. You don't have pity for anybody. We are so selfish, we just think about themselves. If we see a guy, Gau Mata, we have treated Gau Mata very badly. If she can't give milk, we throw her out and, she's on the roads because our selfish interest is over. That is the selfishness. Even if you're selfish, Gau Mata is important for you because the first product is the chemistry that she shares with you. You don't understand that chemistry. If there is something, if goes wrong in the house, Gau Mata cries. If you have that first-hand experience, you should know. Anyways, the second is Gomutra. The third is Gobar. The fourth product is milk. And you are only bothered about what is your selfish interest. Which is why we are away from health. Anyway, I just gave you an example. So coming back to the immune system, which I told you. So any agent entering from outside, like corona, what will the body do? The body will raise temperature to kill that virus. And what is the world doing? It is lowering temperature. Are we helping the body or harming the body? We need to understand this. Temperature will not cause death. Temperature will cause dehydration. Hydrate the body. Understand the body is trying to respond to the insult. Respect the response. So what we did was, we hydrated the patient. Even if it was a comorbid, 4-stage cancer patient getting corona, in 24 hours time, temperature comes back to normal. Most of the cases, 6 to 10 hours time, temperature comes back to normal. Temperature will only settle if the last virus is killed by the body, because the body has raised temperature. Respect the response. We are not respecting that response, thinking that we are scientifically way ahead of the body. No, you are not. No, you are not. That is the first thing. Hydrate the patient. And do not give food on that day. Learn it from animals. If an animal is sick, the first thing it does is stops eating. And we don't know what to eat. We are like, if you give a dog something to eat, it will sniff and tell whether it wants to eat or it doesn't want to eat. You don't know what to eat, what not to eat. And you feel you are the malik of the dog. So we need to understand where we are, where our understanding is. Last time when tsunami was there in 2003, 20 years back, how many animals died? None. They fled. They knew tsunami is coming. You are scientific. You have gone to St. John's School. What happened? What happened? You didn't know? This is where we are disconnected. We are disconnected from earth. You are wearing a shoe that is bad conductor of electricity. This is an electrical body. You are using phone and using a shoe. You are putting electricity inside. The electricity is not getting earth. So this will travel inside the body. If it goes to the brain, it will cause dementia. Your hands will start shaking. If it goes to the heart, your heart will start shaking, called atrial fibrillation. If it goes to the kidneys will start shaking and shrink, kidney failure. So what needs to be done? पांव जमीन पे रखिए, जिनके पांव जमीन पे नहीं है वो बहुत दिनों तक जमीन पे रहेंगे नहीं. We need to understand, you have to put your foot on the ground. हमारे पास पैसे आ जाते हैं, हम कारपेट बिछवा देते हैं, पांव जमीन पे नहीं पड़ना चाहिए. अब वो गाना भी है ना, आजकल पांव जमीन पे नहीं पड़ते मेरे. There is a song like that. Anyways, so I'm just trying to make it more interactive so that you don't get bored and you actually understand what the disease process is, so that next time, if something like last pandemic, if it happens again, you should know how to take care of yourself. So the first and foremost is hydrate. 5 liters of water on an average per person, unless you are contraindicated not to have so much water. That is the first and foremost. Hydrate yourself. Don't lower temperature. And here I have a problem with Ayurveda and homeopathy also. Ayurveda is the mother of all healing modalities known to mankind. Ayurveda is part of Ved. It is the mother of all healing, and it has come in competition with allopathy. Allopathy is just 200 years old or 150 years old. Ayurveda should have guided the way. It has come in competition. What does it say? You've got paracetamol, I've got Sudarshan Vatti. It is a drug versus a drug. What are we? Where are we stuck? Ayurveda tells you what I am trying to tell you, how to live. I'm just trying to tell you how to live. Ayurveda is not, the 5 to 7% of Ayurveda is drugs. And Ayurvedic doctors are just stuck on drugs only. So this is where we are. So this is where we are as far as, so we'll just tell you this, the COVID coming from outside, the body will raise temperature. You don't need to lower the temperature, just hydrate the patient, the temperature will come back to normal in 10 to 20 to 24 hours maximum. The next day, what will the body do? However cells are affected, because there was an attack of the virus or the bacteria, some cells will be affected. These cells have to be killed by the body. What tool does the body have? It will lower oxygen concentration. And what did you do? You gave oxygen. We need to understand where we are. We need to understand where we are and where is science. We did not give any oxygen, and we have to unlearn many things. We are starting a program, Unlearn with Dr. Pandey. You have to unlearn many things. Like, for example, if I ask you, sir, you, sir, what do you take in and what do you breathe out? What do you inhale and what do you exhale? We have to unlearn this, sir. You inhale air. Air has got 20% oxygen only. We need to unlearn these things, to learn new things. Because oxygen favors combustion. It causes fire. So why are you surprised if you are giving oxygen and CRP is rising? Why are you surprised? आग लगाई है आपने. You should have given air. That is what we did. We gave air. The patient survived. You give oxygen, the patient dies. We need to unlearn many things in life. Unless we do that, and these are very simple ways. What I just told you, didn't you know? But because the learning process of reductionist science has been to such an extent that, basic things we have forgotten. 2 plus 2 is 4, we have forgotten because a rocket is going, no? So we have forgotten 2 plus 2. We need to understand that. So the next is you have to increase air inside the body. There are various ways. Before you give air from outside, there are various inside ways. If you lie on your back, one nostril is open. If you want to open both nostrils so that you can get double air supply, lie on your tummy. Both the nostrils will open. And in 15 to 18 minutes time, the pulse oximeter will start showing 98%. What you wanted? What did you want? You wanted that to be 98%. You are using other means which are not required, which are harming the body. Very simple. We made COVID look so simple that people were surprised whether we are speaking the truth. Have we saved so many patients? We made it look so simple. So the second was to put the patient on the stomach. And the whole day, you need vitamin C and vitamin D. So vitamin C does not come in capsules, and vitamin D cannot be captured in capsules. The only source of energy on planet Earth is the sun. Is there any second source of energy? If there is, please let me know. I want to learn. What I have learned is the only source of energy on planet Earth is the sun. There is no other source of energy. Sun is the source of all vitamins, all minerals, all proteins, all carbohydrates, all fats that you can think of. So if you're getting sun's energy directly, you're getting almost everything. And sun's energy cannot be stored in capsules, it cannot be stored in your bedroom or your drawing room. Yes, 5% of sun's energy can be stored in leaves. Only leaves have that capacity to store sun's energy. So why don't you eat leaves? And why are you surprised? Scientists are surprised why elephants don't get cancer. They are looking at the gene. Which gene is responsible? Why elephants don't get cancer? Can we transplant that gene into the human? आप जीन देख रहे हो, आप उसका जीवन नहीं देख रहे हो. Stop looking at a gene. Look at the jivan. Look at the life of the elephant. It eats leaves. Why don't you start eating leaves? You will not get cancer. If you have got cancer, you can reverse it by eating leaves. What is the problem? Learn from nature. We have to learn so many things, which is why we need to unlearn many things. So second day, the body will decrease oxygen concentration. Third day, the patient will crave for salt. Give him some khichdi or something. And fourth day, he will start jogging. That's it. That's it. COVID is over for you. It was that simple. And we simply, it was so simple for us, we were thinking, have they actually lost it? So many doctors all over the world, they are so much worried about COVID. Have they lost it? And we actually did this in so many people, they were saved. So we made this very simple. Similarly, diabetes. Diabetes, we take 72 hours to cure diabetes. Finish it off. Why are you lingering? Oh, this tablet, that tablet, that new atta has come and that will reduce blood sugar. Where are you? Where are you stuck? You simply get away with diabetes. That's it. Finish it off. Don't go by hearsay that, this is there, that is there, this is required, that is required. No. So this is where we are. We'll give a 5-minute break before we come to the end part of what cancer is and how you are going to prevent it. And don't think that is not going to happen to you, because we see cancer as the next pandemic. The way we are seeing things, we are seeing cancer as the next pandemic. So we need to understand how to live, how to avoid cancer. If somebody has got cancer, whether you can reverse it by simple means, yes you can. Yes you can. If you know people who have got cancer, or we'll talk about diabetes and cancer together, tell the patient he will be with you. Many times when we say to the patient, you go away, then he comes back again. No. I have no option. We will go with you. Whatever the circumstance. Because he knows that we are pure at heart and we have one thing in mind. Why do you become a lawyer? Not to be a criminal lawyer. Because criminal lawyer supports crime in the society. Why were you a lawyer in the first place? So that the society is devoid of crime. How many people are working on that? Why did you become a doctor? So that the society is free of disease. How many people are working on that? We are working on that. I am working on that. I am working on the fact that there should be no disease in the society, because like in Uttarakhand, what we are doing is, Uttarakhand are divided into 95 blocks. In each block, we are employing 10 people as our branch. These 10 people, out of them, 7 are girls. We are empowering ladies in Uttarakhand to come forward to be in the healing business, wherein they're not doing it free, they are charging. Somebody from Pithoragarh has to come to Dehradun. Now he is carried and then he is brought to the railway station, nearest railway station, then he comes by train to Dehradun, or he takes an airlift and comes to Dehradun. And by that time he is either dead, or there are so many things that happen. And even if he is treated in Dehradun, we know what the cure is like. what the cure rates are like. He is still a patient. He has to come every 20 days. So whatever he was doing in Pithoragarh is lost. All his money that he had collected is lost. So what we are doing is we are empowering these people to cure him then and there, so that he carries on with his business. And the government is worried, in Uttarakhand the government is worried that, I want somebody to take this video and push it to the government there. The government is worried that, Palayan is happening. Palayan means people are fleeing from this place. Many times it is for medical reasons. We don't understand that. We are empowering them to undergo reverse Palayan. These people will come back. People who have fled their homes thinking that tomorrow if I will be sick, I will die here. So I need to go to greener pastures. This is one of the major reasons why people go out of that place. So we are trying to do that, reverse it. Which is why we are working in an asarkari way and an asarkari way. Asarkari, asarkari sangathan. We are trying to do that, and we are trying to add one more dimension to what our Prime Minister says, Ek Bharat, Shresth Bharat. Ek Bharat, Shresth Bharat, Swasth Bharat. Unless Bharat is Swasth, वो ना एक रहेगा ना श्रेष्ठ होगा. श्रेष्ठ को स्वस्थ होना बहुत ज़रूरी है. So we are holding that, and we are not asking anything from any government whatsoever. No. No grant, rebate, subsidy, no, we are not looking for that. We are empowering people to take care of themselves. If you can take care of yourself, you can take care of your neighbor. That is what the airlines also tell you. पहले अपना मास्क लगाएं, उसके बाद दूसरों का help करें. That is what they also tell you. So we are empowering the people in general to understand the disease process and reverse their disease process. By what? Let food be thy medicine. Just by the food that you are eating. Like, for example, if somebody gets a heart attack, like what happened to one of our Rotarians, it was very sad to know. He is a very young man and got a heart attack. Could that be prevented? Yes, it could have been. Can that not be prevented by rest of the people if it comes to them? Yes, it can. I am here exactly for that. So what you do is, and since I am a scientific person, I will never say anything which I cannot prove by science. So if I am saying something, trust me, either we have proved it or we are in the process of proving it right. Like, for example, why can't you carry a piece of adrak, ginger, in your pocket? Since I changed my trouser, something fell, so my each and every trouser has got adrak. I don't have it today. Ginger, you must be knowing, this big. Why can't you carry it in your pocket? Why sorbitrate? Why not ginger? आपको नींबू वाला साबुन क्यों चाहिए? नींबू क्यों नहीं चाहिए? Why do you need that lemon wala soap? Why not lemon itself? We need to understand this. Where are we? What are we doing? So, why can't you keep a ginger in your pocket? So next time when you get a stroke or somebody says, oh, your face has turned to one side, you've got Bell's palsy and big things. If you want to prevent it in 10 seconds, eat a ginger. What is the problem? Your face will come back to normalcy. When did you last hear it? Where did you last hear it? Probably nowhere. Because ginger does not have an industry. It is available at your home. You can be healthy. If you're getting a heart attack, or if somebody has got a heart attack and he's unconscious, he can't chew ginger, somebody might ask. You make a paste of this mirchi, what do we call it? Chili paste. And you just fix it on his tongue. I am not saying this. 2021 Nobel Prize was on this, please. 2021 Nobel Prize was on piperazine receptors. There are pepper receptors in the body. They release nitric oxide, which dilates the vessels and supplies more blood. I am not saying this. There is a Nobel Prize saying that. So as I told you, I will not say anything that I cannot prove by science. I am a scientific person. I will never tell you anything that I cannot prove. So why can't you do such small things? We have done tests with drugs that claim to increase blood supply to the myocardium and ginger. Since I am a radiologist, we have got equipments, we are testing, so why not this? We did that. You'll be surprised if the claim is per cubic millimeter, if the increase from a drug, X or Y drug that you are carrying on in your pocket is 2 ml per cubic millimeter, even if that claim is true. Firstly, I feel that claim is not right. Even if that claim is true, 2 ml per cubic millimeter, ginger is giving 8 ml per cubic millimeter. What will you prefer? So let food be thy medicine. Let food save you. Which is why the need for changing of spelling of PHARMACY to FARMACY. This will help our farmers also. This will tell them the importance of food also. And why? What we have forgotten is we need to give quantum energy to that food. How do you give quantum energy to that food? You pray to that food before you consume it. We have lost it. Ye Bhartiyata hai. Am I here to teach Bhartiyata to Bhartiya? We have forgotten these things. Why is that important? As I told you, I am a scientist. I am a scientific person. I will never tell you anything which I cannot prove. If you want proof for this, what you do is, same source of water, you take 2 glasses. 1 glass you keep in one room, 1 glass you keep in the other room. One room you go and abuse somebody near that glass. You start talking, abusing somebody. The other room, you go and chant Gayatri Mantra. You call a third person and ask him to taste both the water. He will tell you. Which is why when you go to Mandir and they give you Charnamrit, it is sweet. Why? Abhimantrit pani hai wo. Usme mantra lage hain. So this mantra is the process, the tantra, to keep this yantra going. Do I have to teach you this? Are you not a Bharatiya yourself? So many times we have to remind, we have to become Jambavant. Who was Jambavant? Hanuman had all the powers. Jambavant was the person who reminded him of his powers. So we are in the Jambavant mission also to remind you of who you are, which I feel in the first Man Ki Baat, our Prime Minister did that. He tried to remind you, but very few people actually understood. The first Man Ki Baat was a story of a lion with his 4 children. One of them got lost, and after many, many years, the mother saw that same lion in between sheep. And the mother said that you are a lion. He said, no, I am a sheep. So then she started instilling that you are a lion. What are you doing here? That was the first Man Ki Baat. And as I know our Prime Minister, he will not say anything which is just like that. There has to be a very deep meaning to what he is trying to say. It is just that you need to understand what he is trying to say. Nonetheless, so coming back to our apolitical agenda is we want Bharat to be swasth. And it is very simple. You just need to empower yourself, equip yourself. If you want to really learn many, many things, you should subscribe my channel YouTube channel. It is with the name of Dr. Avadhesh Pandey, at Dr. Avadhesh Pandey. And there are a few more programs that we do. At Dr. Avadhesh Pandey is the channel. You should subscribe that channel, because every day we come up with new things which you will not get anywhere. Because why? Modern medicine I have studied, I still practice. But out of my interest, I know whole of Ayurveda, Naturopathy, Homeopathy, Tibetan medicine, Siddha, Marm therapy, Chinese medicine, Japanese medicine. So that is why we are conducting integrated medicine programs also, and we are teaching people what tool to use to save a life, if at all you have to save a life. A doctor is supposed to be standing between life and death. You cannot escape by saying that, no, I'm a radiologist. You have to go to a cardiologist if you're dying. I don't know anything. Doctor means he has to stand between life and death. If you're not standing, there's a question mark. So which means that you need to empower yourself as far as knowledge is concerned, and empower others to heal themselves or cure themselves. So is it clear that next time onwards, if you get a chest pain or if you faint, what you should do to prevent it? Just eat ginger. Raw ginger, just chew it and eat it, and you will see the benefit. Your face will become red because blood supply has increased. So if your face is red, your heart will also be more red. So the blood supply there has increased because it happens through nitric oxide that is being released. And nitric oxide is one compound which 2 times Nobel Prize was given for nitric oxide. 2 times. I don't know any compound yet for which Nobel Prize in medicine was given 2 times. I don't know. Nitric oxide was one. So nitric oxide is released. Nitric oxide is also released in copious amounts in meditation also. So we need to understand that, the Yoga Bhumi that Bharat is, the Yam, Niyam, Asan, Pranayam, Pratyahar, Dharan, Dhyan, Samadhi. This is the Ashtanga Yoga that we talk about. The Yam, Niyam and Yoga does not refer to any religion as such, but all religions have come out from Yoga. Yam, Niyam has produced Jainism. Dhyan has produced Sanatan. Samadhi has produced Buddhism. So all religions are coming from Yoga, and Bharat is a Yoga Bhumi. Now, coming to diabetes, wherein food can be taken as medicine. How food is medicine? So diabetes is not a blood sugar disease. And diabetes or fatty liver or heart attack or cancer, we are talking about the same thing. We are talking about the same thing. It is like blind people, they are looking at an elephant. The one who catches the tail says that elephant is like a rope. The one who catches the leg says that elephant is like a pillar. The one who catches the trunk says that elephant is like a snake. They are talking about that same elephant in a different way of their perception. So what we need to understand is all these problems that you see, big names, are one and the same thing. It starts with fatty liver. And 70% of the population has got fatty liver. If you don't believe me, get yourself ultrasound check tomorrow. The doctor will tell you everything is fine. You just have fatty liver. That is normal. That is undermining the process. It's not normal. It's not normal. So, as I told you, if you want to see whether you've got fatty liver, see yourself in the mirror. Take a selfie. You don't have fatty liver. If you are not able to see your toes, no need to get an ultrasound done. You have got fatty liver. What are you trying to confirm? So that is where we have made things so simple that people sitting in the Himalaya region, If they want to know what their disease process is and how they can cure it, we are there to empower them to actually know what, how, and how it can be cured. We are trying to make it very, very simple. So coming to diabetes, any diabetes can be cured in 7 days. I'm talking about type 2 diabetes. I'm talking about type 2 diabetes. So 3 to 7 days, any diabetes can be cured. Why 7 days? Because many people have got comorbidities with diabetes. It is good if you don't have comorbidities, then it can be done in 3 days. If you've got comorbidities like kidney failure, like terminal cancer, so that might take a little more time. But 99% of diabetics will be cured in 72 hours. So what you need to do is, you need to reset the body. Your body has gone way away from settings. You need to just press the reset button. How do you press it? Where is the reset button? Do you have any button in the body? So what was rudimentary for you, what you have learned, you have to unlearn. What was rudimentary for you, modern medicine feels the navel is a rudimentary organ. I would want to ask a counter question to anybody practicing modern medicine, including myself. Who puts cotton inside your rudimentary organ? How does cotton enter there? You answer me. How do you get cotton there? Many people feel that comes through clothes. People who don't wear clothes, they also get cotton. Where do they get that cotton from? Navel mein, where does cotton come from? So this is where modern medicine fails. This is as active as anything. And this is the center of you. At one time, you were connected to your mother with this. Everything was happening through this. Suddenly, it has become defunct because you've forgotten your mother. That is the basic problem. Either you've forgotten your mother or your motherland, which is why you are like this. You have to come back. So what happens is, in the navel, why it is important? Why is the navel important? If I may ask you, why is there? You are speaking and listening because of your navel. Did you know that? The energy starts from here. And where it meets the tongue obstructs that energy and kant phoota hai. If I tell you the Sanskrit language has got these syllables, repeat it after me, you will see how it happens. A, B, C, D, you might be knowing. Ka, Kha, Ga, Gha, you might not be knowing. Pronounce it after me, you will know the importance of this. So, you'll repeat after me. Ka, Kha, Ga, Gha, Ga. So, you see where your tongue is meeting the palate. Now, the tongue will come little bit forward. Cha, Cha, Ja, Jha, Ya. Now the tongue will come little bit more forward. Ta, tha, da, dha, na. Now the tongue will come little bit more forward towards the tooth. Ta, tha, da, dha, na. Now the tongue will rest and it will come on the lips. Pa, pha, ba, bha, ma. Now the lips will open. Ya, ra, la, va, sha, sa, sa, ha. This is science. And this is Bharat. Can you do the same thing with A, B, C, D? No, you can't. And it all starts from your navel. So if you look at your navel, the Fibonacci numbers that you're talking about, the golden ratio that you talk about is there in the navel. And the second organ that you've forgotten is the pineal gland. I'm doing a PhD on that. As soon as I'm decalcifying the pineal gland, stage 4 cancers are reversing. So, this is an observation that we are trying to convert into medical means, how we can cure cancers, how we can cure many diseases, any and many diseases. So just by simple things we are doing that. Nonetheless, so what you need to do is you need to reset your circadian rhythm. When was the last time when you got up 90 minutes before sunrise? Wherever you are located, you need to get up 90 minutes before sunrise. You start that on day 1. You start that. And you be a Bharatiya, eat only twice. Whatever you are eating, 50% of your diet should be raw food, 50% can be cooked food, can be, not should be. 50% should be raw food. Why raw food? Have you ever thought that we eat seeds? We eat seeds. What is dal? What is sambar? It's a seed. Huh? What is dosa? It's a seed. Huh? What is anything that you eat is basically chana is a seed. Roti is a seed, right? So whatever you are eating seeds. Why? Because seed has the potential energy to become a tree, isn't it? So you are eating seeds. If you are boiling these seeds, if you take out the boiled seed out and you plant it again, will it give a tree? Why? I am not saying this. You are saying this. So it is dead food. I want to know the science, how dead food is giving you life. I want to know that science. Let anybody tell me that science. What is the science behind dead food giving you life? You show me. So, as a bottom line, live foods will give you life, dead foods will give you death. Unless it is very, very clear in your mind, you will keep on eating mindlessly. It is good to have tasty food. 50% only. 50% of your food should be raw food. And your food should be only 2 times. This is the key for 99% of the diseases that you know to cure them. This is the key. This is the key factor. And whenever you are eating, don't be mindless. Pray. ब्रह्मास्त्र नहीं बनता है जब तक उसको अभिमंत्रित ना किया जाए. अभिमंत्रित करिए अपने खाने को, उसको ब्रह्मास्त्र की तरह यूज करिए. If there is a disease process that is growing, that will go. Unless we understand that, unless we understand our basic nature, अन्न ब्रह्म है, अन्न ब्रह्म है. So we have to do justice with that food. We have to pray to that food. It is giving you life. अन्न ब्रह्म है. So unless you have that regard for that food, you will get so many diseases. The day you start regarding your food like that, all your diseases will come to an end almost. You look at Japan. Japan has the longest longevity. I know a Japanese, I was in a conference. The conference was on 13th floor. The food was on 7th floor. As soon as the lift landed, their posture of the body changed. Unless we give that reference to that food. And what you are doing is, how many of you are Brahma Kumaris? Somebody showed Brahma Kumaris, so I wanted to know, how many of you are Brahma Kumaris? Brahma Kumaris is, they give energy to their food through their eyes. They energize their water and energize their food. If you are praying, you are actually giving energy. People don't understand this because they don't know quantum. They know Newtonian physics. They know that a car walks. You have to just ride a car and then you have to go in a plane and then you have to go in a train. This is where they are mindless. If you know quantum physics, you know you are very close to God. Because normal physics, normal things will not be able to explain what is quantum physics. Can you speak to God? Does God hear your prayers? You increase your frequency, you tune yourself to 93.7 Big FM. Tabhi wo gana aega. You have not increased your frequency, and that is what we do when we are practicing vibration as medicine. So when you come to our third eye clinic, or if we are fortunate to have a clinic in Chennai, you will see a different way of curing people without medication, with many, many things which can be cured very easily just by simple understanding of the disease process. So I stop here, and if there are any and many questions, I'll be glad to answer.
That was fantastic session, doctor. And you have not touched upon that common irritants, sugar, animals, gluten, wheat products. What is this for? Should we eat or should we not?
Yeah, thank you for that question. So, diabetes is a processed food disease. Now, what is processed food? Processed food is not the only food that you get in malls. If you take sugar cane, and if you process it to take out the juice, that is processed food. That is going to give you diabetes. If you chew sugar cane, you will not get diabetes. Unless you understand what is processed food, you will not understand, and you will think that, no, I am doing very well. I am not eating processed food. Everything that you are eating is processed. You have to eat whole food, plant-based diet. Whole food, plant-based diet. So if you're eating whole food, all these things, now coming to dairy, you have to understand the difference between Gomata and cow. Cow is the commercial name of Gomata, which we don't agree with. And milk, since there are many mothers around, I would like to ask them a counter question. Milk, the physical form of milk is there because माँ अपनी ममता छोड़ती है for the child. The physical form of that mamta is milk. So if you are taking milk from a cow, आप ममता का दोहन कर रहे हैं. पहली बात तो ये है, ये आध्यात्मिक बात है. Where does milk come from? Milk comes from a mother, whether it is Gaumata or whether it is you. So many mothers sitting here. क्या माँ अपने बच्चे को जिंदगी भर दूध पिलाती है? ये जानवरों में भी सच नहीं है, इंसान में भी सच नहीं है. क्या माँ के पास जिंदगी भर दूध होता है पिलाने के लिए? नहीं होता है. नेचर इज ट्राइंग टू गिव यू अ मैसेज, मिल्क ओनली फॉर द चाइल्ड. ये नेचर का मैसेज है. वी आर नॉट टेकिंग दैट मैसेज. सो इफ यू आर गोइंग द नेचुरल वे, यस, at times milk is required, but do it the Ayurveda way, wherein how milk is required, how much milk to be taken, what form of milk to be taken, where from you should procure that milk, and till how much time is that milk valid. Did you know that from Gaumata, if you are consuming milk more than 3 hours later than it was taken, you are consuming poison? Did you know that? So unless you understand these things, you will keep on doing the same thing again and again, thinking that, no, I am doing the right thing. You're not doing it. So if you, agar aapko coffee पीना है with milk, why should the milk only be from Gaumata? Why can't you use almond milk? You don't have to boil it. Why can't you use coconut milk? It is much more tastier than, trust me, the coffee that you are having is much more tastier with coconut milk than with this milk. You just have to know the alternatives, how to live your life, a disease-free life, a life which is full of happiness rather than diseases. Because once any family member is diseased, and if you love your family, what is the least thing that you can do? Please take care of yourself. Because if you're sick, your whole family is around you, they will leave their work. You never wanted that. Take care of yourself. Things should be fine. So did I answer your question, madam? Yes.
So there is a big no for sugar, animals, gluten, wheat products and dairy.
Yes.
Yes. And I think a lot of people would like to know about the BP which we wanted to address.
Blood pressure.
I think, blood pressure.
So blood pressure, diabetes we have already addressed. It takes maximum blood pressure. The blood needs pressure to move anti-gravity. Isn't it? The blood is moving from your toe to your head. It needs pressure. Normal body, it needs normal pressure. Fat body, it needs more pressure. So where did blood pressure come from? The fat body. Somebody might say, no, he's very thin, but he's having blood pressure. That is called tophi. Thin on the outside, fat on the inside. So there is fat inside the vessel. Blood has to travel through vessels. And one thing which I wanted to point out the cardiologist, or if this can be taken to the cardiologist, it will be news for him. So what does the heart do? You have to unlearn many things with me. That is why we are starting that program, Unlearn with Dr. Pandey. So what does the heart do? Pumps. Okay. So do you know what a pump is? Do you know how much blood heart pumps per minute? I'll just show you. So if your pulse is 75, suppose 75 pulse, one pulse means one heartbeat. At one heartbeat, the heart pumps out 70 ml of blood, 70 ml. If in 1 minute's time, the heart is pumping 75 times, and in each beat, it is pumping 70 ml, how much blood does the heart pump out every minute? 5.25 liters. How much blood does the body have? Same amount. So what is there is one cell that started from the heart is back in the heart in 1 minute's time, isn't it? Because the body has gone full circle. So one cell that started from the heart is back in the heart in 1 minute's time. You know how much distance it traveled? The blood travels in vessels. If you keep vessels end to end from arteries, capillaries, venules, veins, it is 1 lakh kilometers. Twice the circumference of the earth. 1 lakh kilometers. It traveled in 1 minute's time. You show me one pump that man has made that can pump water and bring it back in 1 minute's time from 1 kilometer. You show me. So if you feel that heart is a pump, either you don't know what a pump is or you don't know what the heart is. Unless you see divinity inside this, chashma pehniye. You need chashma. You have to see this body is divine. Unless you see divinity inside this, 1 lakh kilometers in 1 minute's time, and blood is not water, it's a viscous, thick fluid. So the contribution of the heart muscle to the pumping of what the cardiologists are stuck up with is just 10 to 15% of the total cardiac work. Rest 85%, it depends upon your thought process. Number one, aapko koi wrong news, if you hear a bad news, heartbeat is fast. It depends upon your thought process, your motion, the motion of the earth, the motion of the cosmos, and so many other factors apart from the myocardium. The cardiologist or the cardiac surgeon is stuck only with the myocardium. So it is just 10 to 15% of how the heart functions. If you just take care of 85%, 15% becomes negligible. We need to understand how we have to live. Which is why we need to understand the Daivik and the Adhyatmic angle of any disease and many diseases for that matter. Cancer. 70% of your cancer, did you know that you have generated that cancer and you fully deserve it? Did you know that? If, for example, the physical aspects Lakshmipati has already covered, I will just tell you the metaphysical aspects what he hasn't covered. If I hate Lakshmipati, I'm a gentleman, I might not harm him physically, but mentally I am aroused because of him. This is affecting my Manomaya Kosh. Did you know that the body that you are carrying is the Annamaya Kosh? It is controlled by the Pranamaya Kosh, which is controlled by the Manomaya Kosh, which is controlled by the Vijnanamaya Kosh, which is controlled further by the Anandamaya Kosh. These are the 5 kosh of the body. This physical body that you see, the manifestation of a disease process, has come from the Manomaya Kosh. Because I hate him. So I will get some disease or the other, which will first come in my aura. And then it will manifest in my physical body. So if you are just treating the disease process from the physical body, doing surgery, and the surgeon comes out and says, I've taken out the whole thing, now your cancer is over. And suddenly it comes back again. Because the source is not the Annamaya Kosh. The source is the Manomaya Kosh. Unless you clean the Manomaya Kosh along with this, what you are doing, the disease will come back again. You will give it a new name called metastasis. You will further give it a new name as secondary cancer, something like that. So we need to understand the basis of disease processes. Many times it is outside the body. Fortunately, 80% of diabetics, the process is only in the Annamaya Kosh. So it becomes very easy to cure a disease in the Annamaya Kosh if its origin is in the Annamaya Kosh. Now somebody might ask me, you can look at an MRI or a PET CT or anything which is in the Annamaya Kosh. If the disease is beyond that, how will we diagnose? This is where I come into play. We can diagnose a disease before it has manifested because we diagnose the aura. I do an aura scanning. I've got a scanner which can tell me what is your aura or is there a disease process inside the aura. We are doing that. And we are doing that successfully. And this body is run by energies. Starts from your Mooladhara chakra to your Swadhisthana, to your Manipurak, to Anahat, to Vishuddhi, to Agya, to Sahasrara. This is how the energy travels inside the body. And your thoughts travel downwards, your energy travels upwards. Because most of the times your thoughts travel downwards. Dhara. You have to learn how to make the thoughts travel upwards. Radha. From Dhara to Radha. This is Radhe Krishna. So just wanted to let you know how Adhyatma can be mixed with science, how your learning can be mixed with Adhyatma, with meditation, with so many things so that you understand things and how things move inside the body. So how many kidneys do we have? 2. Right and left, right? Huh? You've got 2. I'm telling you, you've got 3 kidneys. So you have understood me now. So you don't have 2 kidneys, you've got 3 kidneys. Two kidneys, you know it with the name of kidneys. The third kidney is your skin. Your skin is kidney 2.0. So if the kidneys have failed, if you have to make the kidney work again, or take the work of a completely failed kidney, we are using skin as kidney 2.0. We are raising the temperature to 40 degrees. What is your body temperature? 37.5 degrees centigrade. What is the temperature of the water? 40 degrees. So what will happen? Heat will go out. Along with that heat, what will go out? Sweat will go out. Sweat is what? Diluted urine. So if your kidneys are not functioning, we are making skin as kidney 2.0. It's as simple as that. So as I told you in the beginning, we are using science as medicine. We are just using science as medicine. So whatever we are doing, the need for dialysis many times most of the times is reduced. Like suppose if the patient is undergoing dialysis twice a month, it will be reduced to once a month. Then later on, suppose if he is undergoing dialysis twice a week, it will be reduced to once a week, then once in 15 days, then once in a month, something like that, so that it is manageable. Or many times dialysis stops, but we don't claim it. We don't claim that because, people come to us, oh, no, you told me dialysis will stop. No, we are not claiming that. But your life will be much more easier. You are looking at this aspect. Have you ever thought about the social aspect of dialysis? How many people have thought about it? It is the duty of Rotary Club to look into the social aspect of diabetes. So what is the social aspect of diabetes that I am talking about? If a father has to come for dialysis 3 times a week, the son has to bring him. The son must be doing some productive job. He will not get leave 3 times a week. He has to leave that job. If he loves his father, he has to leave that job. He has to get his father to the dialysis center. He has to quit his job. Now there is no income in the family. The son has left his job. The father is sick already. You look at how that family is going down. If we can reduce this to once a month, the child can afford, the son can afford to work, take 1 day leave in 1 month and bring his father for dialysis. Do you look at the social aspect of what we are doing? This is where we are doing it big. Because the social aspect, who will look at the social aspect? So we are doing this for social causes as well. So we are using this tub. We train the person to sit in the hot water, to sweat it out for 2 hours, and the need for dialysis suddenly is decreased or at times stops also. So we are not saying that we are an alternative to dialysis. You should not. Competition is human. Cooperation is divine. We are cooperating. This is the message that I wanted to give. Not that, dialysis now stopped, transplant will stop. No. We are not going to give such messages. We are going to give practical solutions of what your extreme problems are. We will try to reduce your problems to a level where you can tolerate it. So this is what we will explain with this hot water immersion. And not only dialysis, many diseases are cured with this. Depression, schizophrenia, fits, all this. There's a lot of benefit of hot water immersion. There is a lot of benefit of diabetes. If suppose intractable diabetes, the blood sugar is not coming down at all, we use this finally to bring the blood sugar back to normal, like 110 in no time. So whatever your disease process, this is going to help you in any and many ways that you can think happens. How many people know Japanese here? Or know people from Japan? Japan everybody will do a hot water immersion before they go for their work every day. That is why their skin glows and they are so fit. And so this will give a new dimension to your health and a bad dimension to the disease process that you are suffering from.
You're talking about bulgy liver. So what is the treatment for that?
Fatty liver.
Fatty liver, sorry.
Fatty liver, you need to understand what fatty liver is. If it is fatty liver, we are talking about type 2 diabetes. We are talking about heart attacks. We are talking about kidney failure. We are talking about total metabolic failure. That is the first step. Fatty liver is the first step. So if you are preventing fatty liver, you are preventing all these diseases. And people who are diabetics, who feel that their diabetes is okay, and it is okay to be on a disease, and my blood sugar is normal, my life is going, that is mindless living. If your blood sugar is normal on drugs, you have to be lucky not to die of a heart attack, because you're surely going to get cancer. You need to understand, if you're not controlling your diabetes without drugs, you are a candidate for a heart attack death or a cancer death. Unless you understand this very clearly, you will not understand the need for curing diabetes. And you will be mindless in thinking that, no, my blood sugar is normal, okay, it was just a lecture and things like that. So that's why it's important. So coming to fatty liver, how will you prevent fatty liver? You will prevent fatty liver by zipping your lips, eating 2 times a day only, eating 50% of whatever you are eating as raw food. If you do that for 7 days, please get an ultrasound done 7 days before, 7 days after, your fatty liver will go. It is so simple, sir.
We follow all those things. How do we die?
Once again, sir.
How do we die?
First we should understand how do we live. Yes, you're right. So for this, there is a very deep question, sir. I will take this question. Very few people can dare to take this question. You asked a very deep question. For this, you need to understand the basis of Sankhya Darshan. Sankhya Darshan ही भारत का दर्शन है. Now, I will just, people who speak English, solid, liquid, gas, living, non-living and dead. These words have come from Bharat. Did you know that? These words have come from Sankhya Darshan. So anything that is there, like for example this has 3 kinds of properties: Sattva, Raj and Tam. If Sattva gun is more, it will be solid. If Rajo gun is more, it will be liquid. If Tamo gun is more, it will be gaseous. So I just explained solid, liquid, gas to you, by the way. In this Sattva, Raj and Tam, if Purush creeps in, who is Purush? What is Pur? Nagpur, Jamshedpur, Gorakhpur. What is Pur? Pur is a place. Pur is a place where Ushma lives. Ushma is energy. So that is Purush. So if in this Sattva, Raj, Tam, if Purush starts, this becomes Chetan, living. And if Chetana comes out of this, it becomes dead. So, consciousness is stuck inside Prakriti. This Sattva, Raj, Tam is the Prakriti, and the Purush inside makes it Chetan. And when the Chetana goes out, it becomes dead. So this, in a nutshell, I tried to answer your questions. So many advertisements, what is the best food for the immune system? Because somebody says that, no, Chavan Prash is best, haldi is best, giloy is best. So what is the best food for the immune system? Did you know that? The best food for the immune system is no food. Fasting is the best food of the immune system. And I am not saying this. 2016 Nobel Prize was on this. 2016 Nobel Prize, fasting kills cancer. What happens is, autophagy is what? You stop eating, your immune system goes very high and it kills the cancer. It is as simple as that. You are giving a Nobel Prize for that, that's okay, that's fine. And this we Bharatiya knew right from the very beginning. Ekadashi, fast, is what? We are trying to kill cancer. So which is why I want you to be a Bharatiya first. If you are a Bharatiya, you will have health, wealth and happiness. Why? Because many people feel, this Deepavali when it comes, 2 days before Deepavali is what? Dhanteras. Many people feel you have to buy dhan there. You have to buy gold, you have to buy this. Dhanteras is Dhanvantari day. Dhanvantari is the Lord of health. And after 2 days, Lakshmi, Pujan is there. Health is wealth, is the message. But we are stuck in buying gold. Ji.
You had mentioned about fasting. Can you tell us the right time to fast and what are the 2 times to eat?
So, thank you very much for that.
So, Dr. 1 minute, ladies and gentlemen, this will be the last question. I think we need to close the program and doctor will be available with us for a few more hours. We can interact with him one-on-one.
Yeah, I'll be available for 2 more days. Jayanathan ji will be the right person to contact, or Dr. Lakshmipati. I'll be available for 2 more days in Chennai. I'll be staying very nearby this presidency hotel club. I'm staying here, so I'm available for you, for your needs, for your questions. If you have any and many questions, I told you the number also. You can note down my number and send it either in the call center. If you call that number, it will go in the call center. If you just send a message, or if you send a message on WhatsApp, that will come to me. The number is 98150 99999. So you can send me a message, all your questions, we'll try to answer all. Now, coming to the last question of, as told by a madam, and we respect Radha madam a lot, so we'll follow what she says. So, once again, madam, what was your question?
I just wanted to know the best way to fast.
Fasting, okay.
And the 2 times when we eat.
Eat, yeah. So eating should only be during when the sun is there. After sunset or before sunrise, you have to zip your lips. The ideal, you asked me the ideal, I am telling you the ideal. The second is, the first part of the question that you asked was, what should be the fasting like? Fasting is only 2 types, Sajjala and Nirjala, with water or without water. Everything else you are wasting time. Oh, I am on fruit fast today, you are not fasting. Please. So let's be very clear that fasting is only 2, Sajjala, Nirjala. That's it. If you are eating anything that is not fasting, and you are not doing a favor to the world, people say, oh, I am on fasting today, I am on fruits only. You are not doing a favor. You should do favor to yourself rather than doing favor to the world. So if you are on fruits, you are eating fruits. And that is the right way to eat. You are not fasting, please. So let's be very clear on a few things. So, am I clear?
One last question and we are finishing it.
One last question, doctor, sorry. It's the second last question.
No.
Actually, they say is we should eat the staple food of the country where we are or the land we are. We are in South India, our staple food is rice. North Indians eat wheat. But when we are on type 2 diabetes or something, you have written common irritants is wheat products. Then you say we should have chapati. Is it correct or not?
Yeah, thank you for that question. I am so happy somebody asked that question. Thank you very much. So now, whatever I am going to say, please don't quote me anywhere, they will kill me. Doctors are very poor in nutrition. Never ask a doctor what to eat. They don't know. They don't know. With a lot of responsibility, I am telling you this. Because I am a doctor, I interact with these people every day. They don't know what to eat. Wheat causes more diabetes than rice. Rice is a better thing to eat than wheat if you have to eat cooked food. It's so unfortunate that either the process of understanding the disease is not there, or the process of cure is not there, or food as medicine. We are nutritionally blind people. Did you know that Lakshmipati was talking about cancer breast and cancer prostate? We are a hormonally challenged generation. We don't see that. Raat ko neend nahi aati hai. Why? Because your pineal gland is gone. It secretes some hormones which you don't have. Number one. You come down. Every third lady has got a thyroid problem. We are not able to fix it. It's a hormonal problem. You come a little bit more down. Cancer breast, we are not able to fix it. You come a little bit more down. Diabetes, we are not able to fix it. It's a hormonal problem. You come a little bit more down, above the kidneys. Adrenal glands, blood pressure, we are not able to fix it. It's a hormonal problem. You come a little bit more down. PCODs, uterus problems, periods problems, that is called endometriosis. All these are hormonal issues. You come a little bit more down. Prostate. It's a hormonal issue. We are a hormonally challenged generation. We are hormonally challenged and we don't even realize that. And the third is, we mindlessly are taking hormones. Oh, I'll take milk, I'll take this. All these, you are putting hormones inside. Don't expect health. If you really want to expect health, you have to know what disease you are suffering from. That is why, if there is a cancer breast, you have to cut those hormones, please. If you are supplying those hormones, you will never be able to cure cancer breast. And when I tell this to oncologists, they will say, where is the paper? Where is the paper? ठीक है भाई, तुम पेपर ही ढूंढते रहो, पेशेंट मरते रहेंगे. We are actually doing it. We are getting results. Patients are reversing their disease process, and we are very happy about it.
Thank you so much, Doctor. The session was very informative, and I'm sure this is only a beginning. You have shared a lot of knowledge with us, and the Rotarians are going to be here. Please, have some time to interact with us and clarify more and more doubts we
Whenever
have.
I am called to Chennai, I love South India very much, and I feel people are very genuine, sincere. So whenever I am invited to South India, especially Chennai, I'll definitely come. Bangalore, we have started a department. The third eye is in Neelamangala, Bangalore. This is Sri Paripurna Ayurvedic Medical College. If given a chance, we'll start something in Chennai also. We'll be here to help people reverse their disease, and we have no qualms, no issues about it, and we are very clear in mind as to where we are going and what we are up to.
So once again, good morning to you all. From the health team, we have been conducting many programs throughout the year since July 1st. This is completely a one-off program, not initiated by the health team, but by our good friend Jayanathan and his friends. So I start my welcome address by profusely thanking Jayanathan. Where is Jayanathan? Kindly get up and recognize. Single-handedly, he has organized this event. Because I was held up with other programs in the district, I couldn't concentrate initially. Then I thought there is a smooth flow not to disturb. Thank you, Jayanathan. And ably supported by my co-secretary, who is the secretary for the event, Kadir. So with thanking them, I want to start the welcome address. So now it is time to really welcome. Though it's a small gathering, I think people who have not come are missing something big for today. They thought it is just like any other medical program where people will talk and then just go. No. Today is the time we have to sit back and think, where are we as a person having our health? Because we are losing people at random all over the world. And especially after COVID, this becomes more relevant. Irrespective of the age, it is time that we look into ourselves and understand what it is all about. We know this person is made of three things. One is the body that is standing in front of you. Another is the mind that is making me talk this, but there is something inside, that is the soul, which eternally wants to live happily. Are we justifying what our soul needs? Each one of you, we can think for ourselves. Our mind is dictating and the body is undergoing all the damage. We are not taking care of the body. The body will give up after some time. It will start resisting. It will start throwing tantrums. And then the mind will not have any choice. And finally, the affected person is the soul. It will cry deeply inside. We all know that. Before we leave this world, we know how we're going to feel bad. So let us make use of this wonderful opportunity of being a human being and being alive today, and to listen to experts as to how we can further improve the quality of our life and thereby the quality of the society. So with that, now I am actually beginning my welcome address. I thank my good friend Dr. Nandakumar, who has been doing phenomenal job since July 1. His year started with a fantastic medical program in Pural prison. All of you as presidents and Rotarians participated, and there was no stopping after that. We went on and on, not only in health, in other fields, and now he's on top of the world. Another 45 days to go, and I don't know what else is left in his sleeve to conquer this part of the district. He's going to be a distinguished DG from our district all these years. Congratulations, Dr. Nanda, and thanks for coming here. I should not forget, because I have reached to this position of being a director for community health because of two people. And most importantly, it is because of Dr. Sriram, who identified, okay, there is another fellow who seems to have some enthusiasm, let me put him in the position and then see what he does. Those were the days where we were forming a group and trying to identify who can do what, and he, along with our DG, helped me get into the groove. I was so hesitant, including picking the team, and Dr. Sriram immensely helped. He is the mentor for all of us in all the fields. Thank you, sir. I have never had the opportunity to bring him to any stage in the entire year. Probably, I should say, I didn't do my justice in giving him the platform to be the guest of honor. Today is an opportunity. Thank you, sir. I'm sorry if I have not involved you actively, but I always look for your guidance and will continue to look for your guidance. Thank you for being there. And the two speakers of the day. One is, of course, man from Chennai. I'm not going to talk about them. They're going to talk for themselves. And another is a doctor from Chandigarh. I think after 2 hours, we will leave as a different person. That's what I have understood from their profile and what I've heard from Jayanathan and others. So we are all lucky to be here. Thirdly, I would like to invite and welcome all the delegates here, the Rotarians, aunts and Annettes, and of course the Imagine presidents. Otherwise, this program would not have reached to whatever existence it is happening today. Thank you all, and to my host of organizers, including the MC. She threatened me if I didn't tell her name on the stage, she will come and bombard me. So thank you, Radha, for coming and gracing the occasion. Take it smoothly as usual. Thank you all. Stay back, enjoy the day, learn more, and improve your quality of life. Once again, thank you all for giving this opportunity. Welcome you all for this evening.
Good morning to one and all. My Rotary greetings to the VIPs in the front as well as our Imagine presidents, Imagine district officers, my core team, as well as Ram Kumar told, MC, everybody who have made this happen. You might wonder why after a welcome address the DG is going to speak. A little bit I am interfering because I want to say how this and why it came here. So journey to this seminar, as Ram Kumar told, people who are missing, they are going to miss a lot. Even then we are going to have a video and going to circulate it. See, when I think you might not have forgot the bad memories of COVID, the SOPs, lockdowns, the mask, everything. So whatever we have gone through, in some movie I saw that, then only I realized we have passed this difficulties with a great heart, and now we are realized, because even now the COVID is knocking our doors, but we are relaxed because we had a vaccination. At that point, the vaccination has come and proved within a short time. The doctors may agree here. And during COVID 2021, myself, in my family, I lost 3 closed dear and near ones. My uncle, my loving mother, and my young brother-in-law, all because of COVID within a span of 35 days. And myself, I was tested positive. I was in a hospital for 21 days. Then only I had a thought, when we can get a medicine for a virus which occurs once in a century, why not for other diseases like diabetic, cancer, heart, BP, kidney, all those things. So I was going on thinking and reading some medical journals, the papers submitted by experts and YouTubes. At one point of time, there are 2 doctors in my family also. They have adjudged me that I am something wrong with me, and even my son was saying that Papa is going to crack NEET exam and going to join medical college somewhere sooner or later. Jokes apart, my wife also was arranging counseling for me. So I was going on reading some medical journals. Then I came to know with the social media that tub what you are going to see here, that is a tub that is not for sales, that is only for a demo. We will give the link, you can buy, that is different. And that link, the journey, it was very smooth from the day one. Within 45 days, we were able to bring them here. I got Sikandar Dudeja just for buying this tub. Within a day, he gave the link with Dr. Awadahesh Pandey. He was a very busy man. He is sitting here, but he looks patients up to 11 o'clock. He runs a clinic, almost 7 or 8 cities. He will tell about him. And when I was talking to him, he was very polite, and he told Dr. Lakshmipathy is in Chennai, why don't you contact him? And for your information, I am saying, I think Awadahesh Pandey has visited Chennai the first time in this life. And first when we met Lakshmipathy sir, the day one, we were thinking that we were met for a long period. We were very close on that day itself. Thanks, Lakshmipathy sir. And the next, I contacted my own family friend, Kadivel Ganapati Appan, and he said, okay, if you want to go to Chandigarh, take a ticket, we'll go. That because if you want to do something good, the push comes from everywhere and everywhere positive. And when I contacted our DG, Nandakumar sir, he was under Herculean task of conducting 4 elections in a year, and the first time in the Rotary, I think so. And he said, yes, Jayanathan, take Ram Kumar, Dr. Ram Kumar, and go ahead with the program, because being a medical, you can have a community service health. And then I went to our own club member and my guru, mentor, Justice Rajeshwaran sir. He gave some tips, and I told, yes, Jayanathan, you do it, I will come and join. So the journey was going on like that, and at the end of time, luckily, we got an invitation from the Third Eye. In Bengaluru, there is a sugar reversal camp, not sugar free, sugar reversal camp. Myself and Lakshmipathy sir, immediately I traveled there and had an opportunity of interacting with the patients, not the patients, or participants who were get cured within 3 days. We had an experience at Nelamanga near Bangalore, and in that Ayurvedic college. I asked him whether you can come to Chennai. Then the journey came. I approached Dr. Nandakumar. He said, don't disturb the clubs, try some clubs. We tried with 30 clubs, and the response was overpowering. We stopped at 20 clubs, who the Imagine persons are here. Thanks for them. And then I went to this hotel, and also our MC. everybody, that nobody stopped, nobody said, why are you taking this? Because even I am an vocational service director, they said, go ahead. So we are here and make use of this, and because this benefit is going to come from not only from the doctors and treatments, we think that we can improve further. So this is the chance, and with a small quote from Shakespeare, I will complete my speech. Life is neither a midsummer night's dream, nor the tempest. It is a comedy of errors if it is not as you like it. However, not all can become a merchant of Venice. Thank you very much. Enjoy the seminar. Thank you.
Friends in Rotary and to the guests who are here today, I think the more important speakers are all waiting ahead, and I think that's more important than you listening to me and to all the people after me. I think this seminar, which we give as what you call Gyan or whatever you want to say, at the end of the day will make us better people, because you know that the diseases are there all around us and lifestyle changes need to be done. சுற்றி இருக்கும் எல்லாருக்கும் என்ன தெரியணும்னா, நம்மளை சுற்றி இருக்க வியாதிகள் நம்மளோட லைஃப் ஸ்டைல் தான் நம்மளை பாதிக்கும். இந்த ரூமில் எத்தனை பேருக்கு வியாதிகள் இருக்குது, இல்லை எனக்கு பிரச்சனைகள் இருக்குதுன்னு கேட்டிங்கன்னா 90% கையை தூக்குவீங்க. இதுதான் உண்மை. நம்ம யாரும் கையை தூக்காமல் இருக்க மாட்டீங்க. ஏன்னா ஏதாவது ஒரு பிரச்சனை இருக்குது. எனக்கு முட்டி வலி இருக்குது சார், எனக்கு சக்கரை வியாதி இருக்குது, இல்லை ரத்த கொதிப்பு இருக்குது, இல்லை ஏதாவது. I'm just talking in Tamil so I get across. And at the end of the day, you need to realize, as Rotarians, our role is to create that awareness. And today I think Jayanathan, our chairman for this program, has done wonderfully well to make sure that we put together a good package of this particular. And many of you will wonder, yes sir, Chennai city la doctor illaya, yen sara angandu koottu vandinga. When he speaks, you will understand why we brought him from there, for you to listen to him. And I think I don't have to mince words when I say that we have to think beyond the way we normally think. We have to tackle the several problems we see in day-to-day life. And I think in the Mari, or a different seminar will bring out the knowledge which is important. But you know, Saturday morning, trying to get Rotarians to attend any meeting is a challenge. And I think Jayanathan has done well to make sure that we get together so many clubs to join together. And I also would like to congratulate all the club presidents for coming together for this good program which we do. For many years in the past, I think we have done this medical seminar series as a routine practice in our district. Not many districts do that. And I think just like Ram Kumar told, I think Dr. Sriram and I did it in those days. He used to do it alone, then we both did it. Now Ram Kumar is doing it. And I think these will help us to understand at first sight. Because there are several senior doctors you cannot reach. நம்மளால பார்க்க முடியாத டாக்டரை இங்கே கூட்டு நம்ம உட்கார வச்சு we can have an interactive session along with them to understand diseases better. அதனால there is only one thing you need to realize. We have to live responsibly. We have to have some goals in what we eat or what we drink. That is very important. And the lifestyle which we follow. And the lifestyle India follows is definitely not good. We all know that. So we have to see how we have to come back to that so-called normal, or whether it is correct. As one of my friends last week, you know, when I went to one of my old friends, he told, I saw that he had lost a lot of weight. And then I asked him, so you lost a lot of weight, so what is it you're doing? I am just eating home food now, and I'm eating limited quantities of my home food. I told, you've lost almost 15 kilos. I told, yes, only I'm eating idli, dosa, everything I'm eating. But I'm only restricting the quantity I eat, and I'm doing some exercise. And I managed to lose weight. But the interesting story is, many times we don't realize you can continue to eat our own diet, what we follow at home. This is something which is there. Diet is 1%. Second is, doctor will speak about all the other things which is there. But I think, hats off to Jayanathan. Jayanathan, I think it's your single-handed effort which has brought everybody together. Thanks to all of you who are here today. I think this is going to be a wonderful morning. And I think more of these seminars are needed as the years progress, because this is what will bring new perspectives into light as to how we can do different things or do the same things differently. Thank you.
வணக்கம். இந்த ப்ரோக்ராம் ஸ்டார்ட் பண்ணுறதுக்கு முன்னாடி ஆக்சுவலாக இப்படி ஸ்டார்ட் பண்ணியிருக்கிறோம். நோய் நாடி நோய் முதல் நாடி அது தணிக்கும் வாய் நாடி வாய்ப்பச் செயல். இட்ஸ் அ திருக்குறள். I think after the end of the program everybody knows what it is. So now I'll introduce and I'll thank Jagannathan for giving me the opportunity to host this program, one of the host club in this program. Dr. K.M. Lakshmipathy is an MBBS from Mysore University 1987 and postgraduate diploma in nuclear medicine from Bangalore University on 1992. PhD from the Barnyard Institute of Radiology, Dr. MGR Medical University, Tamil Nadu, and 2019. He holds many degrees and he conducts many seminars and he almost published many papers in different journals. Dr. K.M. Lakshmipathy is an experienced nuclear medicine specialist with more than 32 years of experience. He has a vast experience in establishing the nuclear diagnostics and therapy units, specialist in planned for SPECT, CTs and PET CTs procedures for the interpretations. His expertise and lies and delivers nuclear medicine therapy and with the myriad isotopy. I think it is on a medical term, so namely Lodin 131 and SR 89, LU 177 and Y90, etc. He started the 4 major nuclear medicine units at various reputed hospitals in Chennai and 2 dedicated nuclear cardiology units in the 2 prestigious cardiology institutes, namely Vijay Hospital and Dr. K.M. Cherian Institute of Cardiovascular Surgery, Chennai. Dr. Lakshmipathy is recognized as organized the numerous regional CME workshops and national and international conferences in Karnataka, Andhra Pradesh, and Tamil Nadu. He published 25 scientific papers and contributed 2 surgical textbooks and wrote articles in the snippets and magazines. He has presented papers in both national and international meetings, chaired many conferences, and spoke to many webinars. Dr. Lakshmipathy has received awards of honor from the Tamil Nadu and Pondicherry Association of Urology. He has the Best Paper Award twice at the conference held in the Society of Nuclear Medicine, India. He is the first person to head the first PET CT and Siloton of the Tamil Nadu. Dr. Lakshmipathy, stage is yours.
Good morning, everybody. It looks like a medical conference for me. We usually, doctors, when you are having the meetings, like this way, only very expecting anything new. That's what I can see in everybody's face. Something new everybody expecting. I hope we'll reach that satisfaction. I sincerely first thank to all the Rotarians here for coming here on Saturday. As Director Journal said, it is not easy on Saturday to everybody to present. And my heartfelt thanks to Rotarian, Mr. Jagannathan, because he is a very multifaceted person, having interested in various aspects, and medical side he is very much enthusiastic. So I could make out him when I met him in the Nelmangla. We are staying together. He's got a lot of questions, a lot of queries to get know the medical things. So Jagannathan is something like a trainer. He pulled me for all the Rotary meetings and introduced so many people. I am familiar with so many people now already, 2-3 meetings I met. And also he introduced the recent faculty, international faculty at hotel, Hilton. And I thank for all the faculties who are with the invitation. See, this is what the status of a doctor. If you see, the doctor has a lot of bindings. There is no freedom of doing of his own. He has to obey the laws of land, especially the professional laws. the medical, legal aspects and other things. That's what the tiger. It may be government also, because if he's a government doctor, he has to go along with the government policies. Other side, see, that is the expectation of patients and patient attenders from the doctor. It's such a big ocean. So the doctor has to satisfy both the tiger and the ocean. If people will see the Life of Pi, that is a movie which a clip I brought it. The other side, the doctor has to do that kind of work also. You have to take a challenge, risk. In a time comes COVID-19, that's what is the status of a doctor who is himself shielding and try to protect the healthcare industry. So maybe Dr. Pandey is exceptional to this you'll be telling later. So my part, when Jayanathan asked me, sir, what is the topic you are going to speak? I said today, everybody knows a little bit everything, cardiology, nephrology, they know very well through Google information. But some of the thing which is not known to the public is, what is this evidence-based medicine? I am very particular about evidence-based integrated medicine. Nowadays, there is a pro and con, this thing for the integrated medicine. There are IMA accepting some of the things they are not liking it. So what is this? Before coming to that, I would like to introduce my friend, Dr. Pandey. I don't know, it's a coincidence. What is common between Dr. Pandey and myself? We are both did the MBBS, but we are both in the field of nuclear medicine. That's a very nice combination. And we both got the Atomic Energy Regulation Board license and Medical Council of India registration. We both got the conferred the PhD. But another very common interest is both are interested in healing with food as a medicine. This is what the main common factor between Dr. Pandey and myself. So moment we say nuclear, everybody's mind immediately comes to the only nuclear war and the weapons warheads. That's why whenever I never introduce after that experiencing nuclear medicine, sir, you are coming from nuclear war preparation, bomb preparation maker. So that's what some comment from the laymen. So the nuclear energy is used everywhere, whether it's industry, whether it's in agriculture, whether it's in medicine, whether it's a war field. The source, nuclear material name remains same, but our nuclear energy is entirely different format. Hope all of you recognize Dr. APJ Kalam sir. He came to my department just before getting into the president post. The legends are always some different in their futures. What is his characteristic future is, he just listens first. You'll never allow anything his comments. You listen to the people what they want and talking. So when I came to department, I told, sir, you are entering to the nuclear medicine department. Oh, nice. So you are doing some nuclear war with patients because he's a war-head person. I said, no, sir, I am not a nuclear war person. I am using the atoms for the peace. It's a noble cause for the healing the patients and treating the patients. So, dear Rotarians, you are going to have a panorama picture of what is this nuclear energy, how it is linked to the body, care and health. It's a very interesting. I will be taking you to the one by one areas. If you ask me, where is not available this atom? Atom is there everywhere. We are all made up of atoms. So it is there in the life and in non-living things. Everything, we are all mass structures, mass made up of the elements, and elements made up of atoms. So we are all there already with the atomic life. So what is this pure, those who are not familiar with this, what is this nuclear medicine we are talking? It is a specialty where it is radioisotopes are used, which are safe and less radiation, less hazardous. That's how the Government of India and Atomic Energy Regulation Board, both national and international level, given a permission to use them for various purposes. I am going to tell them and how it is linked to their health care. So what we can see in the diagnosis imaging, we can also treat them. That's what called theranostics. So you can see the same thing and you can treat them also. If you see why this nuclear medicine required when they are having so much availability of various biochemical tests, very high level imaging sciences like CT scan and MRI scan, and various biomarkers. Despite all these things in medicine, we need this kind of modality. Those who have not seen the machines, these are the pattern of machines available for usage for the nuclear scan procedures. This is called single photon emission computed tomography. That's called positron emission computed tomography. This machine came to India 50 years back. That PET-CT machine came 20 years back. Although advancement of PET-CT, we are just at that time 30 years behind any developed country. But luckily, the Tamil Nadu not delayed. Immediately they got it, the PET-CT in the right time. This is the first PET-CT completed now 15 years. I'm amazed to see the experience of it. See what we see, why we are not limiting at the ultrasound and biochemical test and CT scan or MRI. Why we need this? Because of this. You see the way you can see the body, any organ in your body can be imaged by using these atoms. That is the beauty of this science. Not mere seeing it. The information what you are getting it is extraordinary. What is happening now in real time, like you are sitting and listening, how the brain metabolism happening, that can be seen here. Whether you are feeling depressed, that can be marked here. Whether you are excited or you are having an overwhelming kind of medical, meditation status, that also can be seen here. That is only just example of brain I'm quoting. Imagine how the heart will be feeling, how the kidneys are functioning. Everything can be seen by this modality. This is not possible by any modality available so far in the medical science because it is a physiological study, also a simple technique by using the radiation detectors which I told, SPECT and the PET. So this is how we can see the whole body. Nowadays, because of earlier, it was like astrology. Stars in the sky only. Like that way used to be the picture. Only nuclear medicine, like astrologer, he can only read that. Doctors are unable to understand that. But because of advancement of hybrid technology, combining anatomy and the functional information, it made very easy now. You can yourself see, sir, I can see the brain, I can see the lungs, liver, spleen, kidneys, and skeleton. That's how it is very handy, and you yourself able to interpret it. That's what made very easy. This is what everybody after now, all over India, PET-CT numbers earlier only hardly 10 or 15, now it is crossing more than 100. When I visited Japan 15 years back, you see the Japan size and the population, and compared to the Indian population in the size, they had that time 120 PET-CT and around 100 cyclotron. I was unable to believe that. We were only having 20 that time, but now we are evolving and putting this machine because it is very useful. I will tell you how it is useful. Everybody afraid of cancer, I know. Even me, cancer, it's not an easy situation. But you see, I spent now 36 years with cancer patients. I understand there's a huge problem there. We are only seeing the patient after coming cancer and repairing and this thing. But nobody doing the prevention part. If we can prevent it, we can avoid the way we are looking at the cancer like this. So everybody is spending more money for the treating, big operation theaters, big machines and various surgeons. But nobody has made a preventive part. I think that aspect I watch Dr. Pandey going to make a big noise in India, probably the first physician going to do that, and he's doing it. And it's very interesting when you start talking, you can understand how he's going to prevent these all sort of cancers coming up. This is just to show how the whole body, initial, like it's the black, what you are seeing is the lung total cancer involved. It looks very colorful, but it is not easy for the patient and the surgeon also, because is a lot of management is there. The purpose of this machine is not only diagnose the cancer lung, that can be diagnosed by simple X-ray, but where all this cancer has spread all over the body, because that staging is very important, whether to attempt surgery, whether to attempt chemotherapy or radiotherapy or palliation therapy. Palliation therapy is just allow him to die peacefully. These are the things comes to the planning. Their whole body screening with this kind of PET-CT modality is must. This is the very commonest for the females issues. The breast cancer incidence keep increasing. Reason I will tell you, and also Dr. Pandey tell you how to prevent the breast cancer. This is how breast cancer can be seen by PET-CT in the whole body, and also the breast cancer alone, or it is spread elsewhere, it will be mapped out by PET-CT. So this is a different kind of breast cancer. It is spread a huge area, and also the distally spread to the bone metastasis. This is sometimes cancer get healed and people come for follow-up. Suddenly they come with some other problem. This patient treated well for CA breast, but she has come with the brain metastasis. The disease has spread to the brain. The whole body is normal. So there are a lot of challenges in going to be there, and we are attending it in cancer patient. This is a very tough area. We are unable to prevent the 100% arrest cancer. For follow-up, something they can come up. This is very problem for the all males. As we are getting aged old, the prostate getting enlarged. For that, again prevention, Dr. Pandey is the solution. And once it comes, there is a big areas of management to operate the prostate. And if it is spread, it is already spread to the lungs. This is the prostate, already spread to the lungs. So he has to be managed surgically, plus then chemotherapy and these are all the three combinations. Everybody has to face it, either in the vice versa, directly first radiotherapy or surgery later, like that way. This all depend upon the planning of the treatment. This is again CA prostate, cancer prostate with bone metastasis, bone pelvis bone you can see. Nowadays, the molecular biology is so much improved, we are very target specific. Like how by sitting in the computer, anywhere in the world, you can, specific area you can target. That's how the nuclear medicine, by using various rockets, that is the radioisotopes, you can put the warhead, that is the target material, and you can reach specific. If you want only adrenal to be seen, you can see the adrenal. If you want only lymph node to be seen, only lymph nodes. That's how the specific isotopes are available, and also they are very useful for therapeutic purpose. You can treat them. This is what the extension cancer can go in the body. You see the normal skeleton. If you do the skeleton survey for the normal healthy person, this is what it is. You see I need not explain, your observation itself sufficient. It is such a bad patient having widespread disease all over the skeleton. So this is how we are very good in showing this easily by our technology, but I am not happy with this image because we don't know how the physician going to handle this group of patients. They have to do a lot of palliative therapy. You cannot attend. But there are some miracle also. I'll show you how the treatment happening and how it is useful. You see, this is this side. This is a cancer prostate, male, having widespread disease, including bones. Nowadays, we got, I said, target nuclear medicine therapy. You see the follow-up. The same patient is getting well, and even bone tumor are getting well, and then you see the last scan. Don't you feel it's a miracle? It is a science. The whole disease, cancer, has been tackled and treated with radioisotopes. This is the advantage of nuclear medicine. So, we can assess them in any level, whether before diagnosis, during treatment, and post-treatment. So that's how it is very useful, whether to stop the treatment or continue the treatment and advise the patient what to do or not to do, anything. So that's how, if patient has any disease, you have to do follow-up always. Diagnosis and intervention and follow-up. So, example to show radiotherapy for a lung cancer is given here. This is a pre-therapy scan cross-section. Lung, if you take chest, you can see the lungs, the dark area, and the white one is the disease that has been targeted by external radiation. Ours is always everything internal radiation. The radiotherapy is always from outside radiation. So outside radiation when they plant, you see how much disease has been reduced by radiotherapy. So this quantification is only possible by the technology of kind using the computer assistance. See the same other group patient, they are given radiotherapy, but the later follow-up again, it is coming up. So it is not that everything finished by giving one treatment in cancer. You have to be always under the follow-up for observation. It can reoccur again. This is what very interesting, not related to the cancer. Whole world suffering with this problem. That's called fatty liver. Whether you take alcohol or not alcohol, fatty liver is known. This is the main cause of various diseases in the body, and not many are taken seriously. Today, I think more than 10,000 patients waiting for the liver transplant. Apart from the kidney transplant patient, this liver transplant also very much in the queue. So Dr. Pandey is going to tell how to prevent this and how to get rid of this fatty liver. Prevention, and also will tell, even if you are having fatty liver, how to get rid of it, not to get fear, to be happy with fatty liver. So that's what my today role is, to bridge your need and Pandey's speech, so that it makes easy to understand after this lecture. So fatty liver is one of the dangerous issue. This is the one lady. They say, she is very thin, sir, nothing to expect. There is nothing like that in a body. You are thin, you are no disease. You are fat, you are having disease. It is not like that. She is a thin built. Her diet habit is so different, and that made her fatty liver so much. You see the black area here, right liver is the normal, that's the isotope distribution. But if you see that side, liver is not at all taking the isotope. That's how this isotope technology is so useful to demonstrate the functions of any organs in your body. So same thing in cross-section, when you do it, you can see the liver CT scan also. See the difference between CT scan and PET. The PET is color one, and the CT is the black and white. It will give the beautiful picture of the structure, no doubt. But whether the structure is alive or dead or functioning, only adding on this isotope will enlight. That's why it's called lighting, scintillation scans. It will give the light up and tell whether it's dead or alive. See, that liver is totally looking all right in CT, but fatty pattern, but whether function is there or not, there is no function in the liver. So this is what very important. Today, just now morning, we mourned a Rotarian we missed, unfortunately for a cardiac ailment. This is what not told by the cardiologist to common public. I am sure if I make some statement, it will be a big scenario in the cardiology. See, there are some tests which can be done in advance to predict the future course of their patient diseases. Example, this particular scan is called myocardial perfusion scan by using radioisotope. It can predict at least 1 year in advance what is the chances you will get the cardiac attack and into the cardiology ICU. 1 year in advance. Those who does this particular test in 1 year in advance, electively they can choose their pattern of the life and the dreams. If scan is normal, at least we can assure you are not going to have event for next 1 year. This is advice for the all risk factor group like diabetics, hypertensives, the above 50, very risky in the stress life, busy schedule, overweight, obese. All these people should, like, you go promptly to your car service and maintain the date and do the nice insurance. Promptly you do for your car. You don't want car to be disturbed by any dust. But you are not looking at our engine. Our heart is the biggest car engine is sitting inside. We never service it. We never look at whether it is sufficient to work for another 50 years or 60 years. That can be assessed by this procedure. No other test is possible. Stress echo they do, but it cannot predict. Only this can. The basic principle behind it is very huge. I don't want to go detail to the medical, those principles. I think I remember our guest of honor, Sri Ram, has underwent this study. See, I remember, I must have done this study 5 years back or 6 years back. 6 years, sir? 10 years. See, my test assured 10 years event-free for the Dr. Sri Ram. Can you, I hope this is most evidence, this is what the evidence proof medicine. So, sir is very comfortable. And his heart scan was normal. I did it in Kamakshi Hospital. So I'm very happy he is here today and he is the living example for cardiac evaluation. So this is what normally when you do the cardiac scan, heart can be taken in the 3 direction cuts. Like this cut, sagittal cut, and one more cut, 3 dimension. If you cut the heart, it will be ring type one side, another one C shape opposite, and U shape in the down. These all colors, both, it is not mere alone resting steady, anything you do, you may look normal. All of you do ECG now in the resting steady, you may look normal. But you will be seen your capacity of heart only when you put into the stress. So you have to do treadmill, and those who cannot do treadmill, we are having a chemical compound adenosine and dipyridamole. We can push that and make your heart rate to increase, and that particular peak of the stress, your scan normal, that is what stress top row and rest down row. If you compare both normal, it assures, according to the literature, sir, 2 years to 9 years. But I am not telling everybody that much length here. I am at least assure you 1 year. 2 years is also possible. SAR is more than 10 years. So this test is must. It is not a non-invasive test, doesn't need an admission. No reaction, very simple to do. Stress 1 day and rest 1 day, or in the same day we can finish it off. This will help to say that my heart is strong and I am able to live without heart elements for another 1 year. This is useful test I used to do for pilots, for license renewal, ship captains, and various executives at the top profile they got. And some of them were taken very high insurance values, 10 crores, 20 crores. For them, I used to assess this test in nuclear cardiology. Because I had 2 nuclear cardiology, one Vijaya and Dr. K.M. Cherian Hospital. So busy, they used to have this kind of patients to get the clearance cardiac scan. So just to show how you saw the normal heart, how the cardiac problem is there, how the scan will be seen. You can see that ring there. That particular black area is the stress. During stress, that much blood supply is cutting off. Cutting off is not able to reach there. Because of there is a coronary is getting narrowed. In a normally heart, when you do walking or exercise and running, it will accept anything which comes more than, the flow will be blood in the heart will be more than 4 to 5 times of the normal. When you do the jogging, exercise, and jumping, skipping. In that period, when you increase the blood more than 4 times or 5 times, if your heart is stable, then the ring looks like this, down, normal color. If the coronary vessels are narrowed more than 60%, that is what cutoff value for detecting the scan. That's another useful scan criteria. If more than 60% coronary narrowing is there, immediately after during stress, that kind of defect will be seen in this stress study. So that is the advantage of significance of the coronary narrowing and also criticality of the extension of the blood supply deficiency. That can be seen by this study. This is a typical stress-induced ischemia, we say. Somebody people know, you ask them to climb the steps, they say, sir, difficulty, sir, I'm getting breathing difficulty. That happens because of, during stress, they get the blood supply low and heart cannot manage. The down is a rest study. You see the same patient. In the rest, the whole ring is normal. So if you do only rest ECG and rest anything echo, it will be normal. You cannot pass that patient, you are all right, unless you do the stress study. This is very interesting. Please see this graph, where we stand and where our cardiologists are handling the cases. If you see the initial blood flow will be normal in a normal patient, and the first one to affect is nuclear scan. The first initial, the narrowing of the coronary, when it starts in the initial phase, nuclear scan pick up the incident, what happened, why the blood supply not going. That can be seen by physiological information only by nuclear scan. When you start increasing, you see ECG changes comes only after this step. Your ECG normal doesn't mean you are normal. There may be changes in the stress. And after the ECG, you are getting, when you are getting, after getting 80% narrowing, you are getting the symptom. People say, I'm symptom free, I don't have a chest pain, especially diabetics, they do not get chest pain. Please note, chest pain can be there for other group, but diabetics they will not get because of neuropathy, they do not get the sensation of chest pain. Chest pain doesn't mean that it doesn't have a disease. According to the literature, all diabetics are nuclear bombs. Anytime they pop out. You see the symptoms of chest pain coming to the, and cardiologist seeing when he is seeing at the almost above 60% narrowing of the blood coronary vessels. That is where the symptom you get it. So, are we ready waiting for the symptoms? By the time they will think of you doing bypass graft and angioplasty and prognosis depending upon this thing. But I want you to see at this level, myocardial scan level, where you will be cleared, sir, you are all right, another 1 year, nothing to worry. This is what my intention to express. No doctors, I am telling you, even doctors are not aware of this information. The issue is, everybody is institution, everybody is expert, but do not interact with what other modality is doing. That's what my friend Pandey is very much interested. Open the area of interest to benefit to the patient. Look at only your modality, it will not solve the issues. We need sometime even small other specialty help to help the patient. You will be delivering regarding that. I hope you could see that the stress, that's what the defect, and the rest recovers. This is a typical ischemia. This has to be excluded in especially diabetic patients. Nowadays, technology is available. Combined CT scan, you can see the coronaries also, and see the perfusion also, myocardial isotope study. That's called SPECT CT and PET CT. So we can see the function, and we can see the metabolism, and we can see after the angioplasty or bypass surgery, how much your blood supply before surgery was deficient is improved later. This is what we should do, because no cardiac surgeon and no cardiologist recommend to do this study. This is what my evidence-based medicine. If you have done a good surgery, you have done a good angioplasty, you have to show that post-surgical recoverment. This is what all the international institute does. Without this scan, they will never decide anything. There is some issue with our protocol in India. I showed you two machines. This is what SPECT can do, down. This is what PET. PET deals with the metabolism. It goes to the cellular level and see the glucose metabolism and fatty acid metabolism. But the SPECT only goes at the flow, blood flow, wherever it goes, it just goes and maps it out. So both are relevant, both are useful. Here, I can tell which patient need bypass surgery, which patient need angioplasty, or both are not essential. PET can tell whether you need a bypass surgery or not, or whether you need an angioplasty or not, because it is at the myocardium, cellular level, and metabolic level. This is called molecular science. See, this is what we are doing for various VIPs only. It is not to the common people. I do for all high profile, the top bank, DGM, somebody will be there. Those only getting benefit of this study. There only cardiologist will speak to me, Dr. Lakshmipathy, can you take care of, I am referring this concept. Because they want to be such high profile only be taken care like this. They will never make use of this for the common public. This is must for the everybody. The test is useful for everybody. I am coming to the end of my lecture because too many examples, not much confusing. I am interested to enhance first the cardiac part and the cancer part. This third part is again kidney. Kidney also we got a major role to see how it functions and how the urine is formed per minute. All this can be assessed by our test. It's a very simple test, half an hour we do in our department. So, what is important in connection to this today event, you can see there is a hot water bathtub there, which is very relevant to this kind of kidneys which are not showing the blood flow and urine output compared to the normal patient. So those who are in renal failure, dialysis must no doubt, but to reduce their dialysis frequency and reduce their mortality, because they are known for the cardiac complication and skin diseases, and inter-dialysis they may put on other complications, putting on weight. These can be reduced by using the hot water tub that Dr. Pandey will highlight. I will not go in detail to that. So this is how we can help pre-treatment and during treatment and post-treatment. We can assess directly how much kidney function improved or deteriorating, or how much urine volume improved excretion. This can be assessed by radioisotopes. So, like any other organ, brain also, we can do a lot of wonders, especially for epilepsy. We will pick up exactly where is the site of epilepsy. That is very useful for surgeons. If it is non-responding to the medication, they have to operate it brain. So if you show where is the epilepsy focus, that's called common terminology, we say fits. Where is the fits focus in the brain? We can show where it is coming and they can help the patient. This is something interesting, please observe here. Normal brain profile, I put it here. This is how the normal brain surface images actually, its activity and normal brain. If you are overweight, how the brain gets the function and blood supply differences. You see the overweight, activity goes down, brain, and the inside function vessels are very microvascular dysfunction. It is well demonstrated, documented by these kind of techniques. After seeing only it is ourselves surprised these all things happens in our body just for excess weight, because it has to do a lot of activity. Similarly, obesity. Obesity, how much it disturbs in our brain functions. Same thing can be assessed for various issues like dementia and all. That is too much for this session. Sometime we can take it deep to the brain function evaluation. So what is happening, I just told you in the beginning itself, whatever we are thinking, whatever listening and enjoying, everything documented in a metabolic imaging. I do a lot of glucose metabolic imaging. Patients when coming for whole body scan, for cancer patient, if you see their brain totally depressed, they are worrying and thinking. That can be documented in our all cancer patients. So this is the functional usage of this PET-CT apart from diseases. We can do a lot of wonders in the functional imaging, like meditation, yoga, all can be monitored by the molecular imaging brain. This is what happens during synchronization of our brain during resting, just doing meditation. This is what demonstrated by nuclear studies. This is one of the important component. Most of the hospitals, those who are doing organ transplantation, there are some issues to prove heart will be beating, but no function of brain. So we have to prove brain is dead. It is not easy to say patients, attenders and others to convince the brain is dead. Shall we give a permission? Are you having any permission to transplant the organs? How to give the evidence? This is the evidence. If you see a normal brain, when you push the radioactivity, it goes to the brain and distributes, and that's what blackened area. But in a brain dead patient, when you push the radioactivity, the whole area remains empty socket, the brain. This sign is sufficient to take care of organ transplantation. This is one of the useful scan of nuclear studies. Same thing, if you do the dead patient CT scan, you cannot say whether patient dead. If you just give this picture for a doctor, you cannot say this patient is dead or alive, because it's anatomy. That is functional imaging. So anatomy and combined function is helping lot of decision making. So these are all the evidences useful for medical legal aspects. So this is what my topic of interest, but I took into all this area because before Pandey speaks, you should know all this information, makes you easy to understand. So we are talking about this thing. Everybody knows doctors coming under consumer law. Everybody eating the doctor left and right openly without concerning anything. There is no police protection. Doctor is a very easily available soft target for the public. So we should be very careful with whatever we speak and document and talk to the patient. There only this medical evidence is must. What is this medical evidence? This started by the 1990 by German. He has made some policies. Any document of the patient should be of that standard for applying treatment and follow-up. That's what we call it as evidence-based medicine is practiced now. Coming to the situation now, you see what are the kinds of specialties available in the medicine. Okay, finish. We got a conventional medicine, we got an alternative medicine, we got a complementary medicine, functional medicine, and integrative medicine. So the patient do not know what medicine is to be taken. So every modality has its own limitations, advantages. Now everybody talks about health, whether our Sadhguru or the Sri, anybody you say you do this will be all right. That's how the medicine is so much diluted by various group of people. So there is a big PIL in the Supreme Court, and Delhi High Court is asking the government, make it clear what all the syllabus to be modified, what all the syllabus to be deleted based on the evidence. That's why this evidence-based medicine is very relevant today. So we got integration of yoga and even a simple diet changing can change the medicine to a complementary medicine or a integrated medicine. It doesn't make a much difference. Allopathy doesn't deal with all these things. That's why it is nowadays more attraction for the integrated medicine. So we always, in a evidence-based medicine, we have to ask all these things, how the medicine will be treated, how it happens, why, who, and where. This question to be answered in evidence-based medicine. So example, why integrated medicine? That gentleman that side is in New Zealand, is a police officer, he had a blood cancer, he didn't take any treatment. He took a complete vitamin C infusion inside the body. It is his own plan. No doctor told it. And amazingly, his evidence is proved by pathologically, the cells become all right and he is all right and he is alive now. So this is what a miracle. But that should be adapted if it is working out. In allopathy, it do not permits. Vitamin C, nobody give IV infusion, but he is surviving, he is in New Zealand. So that's why these all evidences, if it is not matching, then the allopathy do not accept it. So methodological approach also necessary in a medicine. And these are the things nowadays available, nutritional, psychological, physical, and combinations. See, there is already integrated medicine available in best reputed institute of our country, National Institute of MNAMS, National Institute for Mental and Neurological Sciences. They have got a combination of yoga, Ayurveda, and allopathy, and neuropsychiatry together, and psychologists. They are working on so many mental disorders, and they are publishing a lot of scientific papers. So this is to show there is evidence, and based on that data is possible. So a lot of publications also coming up now with various non-surgical and non-medical treatment, adopting yoga and meditation and herbal therapies. There are a lot of disease has been cured. So there are several examples I can show to you. Because of shortage of time, I am running it. This is what the evidence everybody is expecting. It should be either scientifically proved, published, or multi-trial meta-analysis has been done. That particular gentleman is a boxer in the USA. He's a young man. He was proved cancer colon of 15 centimeter size, but he is not ready to undergo surgery or chemotherapy. He just cured it by simple fasting and changing the diet into keto diet, and he is living healthy, happy. So this is proved by the, again, biopsy and CT scan and the PET CT scans. So like that, now even these kind of Brahma Kumaris and also talking about mental cooling and all to reduce the BP and all. So these are all coming under not allopathic. These are all complementary. So how to adopt them? That is very essential. So as WHO says, it will not fit for everything. Everything cannot fit for everything. So it should be personalized medicine. Nowadays, we are going with the more of personalized medicine. This should be taken care. Each patient is different. So I will not go to this. These are the advice nowadays. America, please see, this is America is advising. India is not advising this. My institute not advising this. They say what to do, what to eat, how to prevent everything. They are advising nowadays. They are very preventive. They are taking more steps. Nowadays, the food aspect also, my Dr. Pandey is going to tell how this kind of food will help so many disease prevention. Just to run fast, she is an American board neurologist. She is a best in the karate and kung fu. Suddenly developed multiple sclerosis, autoimmune disease. Anybody says autoimmune disease is a lifelong procedure, debilitating, and you should be on steroids. That's what the allopathy protocol. She is being a neurologist. She refused any medicine. She went on eating the green food and multiple color vegetables. You see the current, this is her debilitating status when they advised medicine. She was sleeping on the chair. You see, she is using horse riding now. So she changed her diet and changed her disease also free. She is another cardiologist, American board certified cardiologist. She developed rheumatoid arthritis. She also refused medicine. She went for the vegetable diet. And she is giving now a lot of textbook and writing on medicine, the diet, and she's been famous in audio, video, TV. She is Indian, our Mumbai girl, engineer. She had a rheumatoid arthritis. She suffered for 10 years with all medications. Nothing improved. She went for, again, diet pattern, changing vegetables. She is happy now and teaching the other patients. This is very interesting. A fracture happened, and that is the post-operative putting the plate. And this plate, the bone fusion got delayed for more than 1 year. Giving diet, changing the lifestyle, and morning you have taken water, that water to be increased more than 10 times a day, at more haldi, and the layman, and the last person is my fracture lovely picture you are seeing there. This is operated in Kamakshi Hospital. My fracture, my friends told you have to go for fracture repair, or so many other therapies. I refused, but I accepted Dr. Pandey, and I am able to operate my right hand. So probably allopathy doctors are like this. You see the beautiful elephant? A small rope is sufficient that elephant will stand there for morning to evening. Because the elephant is trained like that way, you cannot do anything as long as a rope is there. So it believes rope is there, I cannot do anything. Though it is a powerful, I take the rope and go away. Same thing with the allopathy doctors. We are such a powerful, having a background of the physiology, chemistry, but we are unable to use it appropriately when it is necessarily needed. So we are just locked by rope of Indian Medical Association, Medical Council of India, and so many guidelines. So my friend Pandey is like that. Thinking out of the box, let it be there. As long as I am not inducing any complication with diet, I can do that. That's what my friend Dr. Pandey. So he treated several COVID patients. So I am very thankful to him for helping so many patients. So he believes in this. He is alive 2,400 years back, Hippocrates, and he said, let food die the medicine and medicine die the food. That stands today, holds good. I think he will become next Hippocrates of our India. So at last, ethics remains same for any complementary medicine and integrated medicine. You have to be with patient, and patient deserves to know whole truth about what you are doing, what you are not doing. Everything is patient has a full right to enjoy the good medicine, and doctor should go with the patient. So thank you for listening, patient.